Hello, my dear friend. Today we are going to discuss the 100 expected question for your upcoming FMGE exams. So we will also try to understand that topic also. First question is based on equivalence study. Suppose you are doing a randomized control trial to know whether your new medicine can lower drug or cannot lower drug. So you are comparing your new medicine, suppose it is drug X, with existing drug, suppose amlodipine. And this zone which you can see here between this blue line and this black line, this zone is known as zone of equivalence. Zone of equivalence means if the result of your trial come in this region, it means your medicine is neither better than amlodipine nor worse than amlodipine. अगर इसमें रिजल्ट आया तो मतलब आपकी दवा और एम्लोडिपिन एक जैसी ही है. अगर if the study result is like 1, which is totally in the favor of drug X, vehicle means it can detect both 𝐌𝐿 and falciparum. Optimal kit has which enzyme? It has lactate dehydrogenase enzyme, and it can tell about both the things, 𝐌𝐿 plus falciparum. Okay. Second question is this blood smear which we just draw here. This blood smear is from thin blood smear or thick blood smear, because when MPW do active surveillance, I hope you know MPW have male multi-purpose worker or health worker male, he have to visit every house of the village once in 14 day. 14 दिन में एक बार घर गांव में सभी घरों पे जाएगा और जाके पूछेगा घर में किसी को बुखार है क्या, does anybody have fever in the house. When he visit once in 14 day, he asks this question, and if anybody say yes I have fever, he will take the blood smear and he will make two blood smear, thin and thick blood smear. So thin smear will have less blood. This will tell gametocyte. Thin smear will tell whether it is 𝐌𝐿 or plasmodium. So thin smear will tell species. And why it is active surveillance? Because we are going, MPW is going, health team is going and searching for hidden case. So active surveillance is for hidden case, and thin smear, which we are telling about species, this is tested by 𝐿𝐿 staining. This was one of the INI-CET question, that which staining is gold standard for detection of malaria species. So 𝐿𝐿 staining. We can also do acridine orange or Buffy coat staining, but gold standard is 𝐿𝐿, and thin smear tell about it. Okay. Chalo, so this all information you should definitely know. Now, what is prospective screening, and it is done in which case? So let's say you and your girlfriend or boyfriend decided to move to Netherlands or any Scandinavian country, Norway or somewhere. And when you will go there, first they might take your X-ray chest to detect latent hidden TB in you or TB in you. And then for the next 3-5 years in future, they will keep taking your chest X-ray to know whether any TB is hidden in you or not. So this screening is going in future. When a study go in future, we call it prospective. When a study go in past, we call it retrospective. Like case control is retrospective. Cohort is prospective, because cohort goes in future. And where we are doing it? We are doing it in case of immigrant screening. When immigrant are going to other country, then we are following them for a very long period of time. So that is a type of cohort study. Other example of cohort study is definitely two famous study. One is Framingham Heart study. This Framingham Heart study was done on doctors for 54 years. This scientist Framingham keeps sending question letter to all the doctors, that क्या तुम सुट्टा पीते हो, क्या तुम दारू पीते हो, तुम गांजा क्यों नहीं फूकते हो, है ना, that whether you smoke, drink or not, about all the lifestyle. He kept asking question, and then he asked, did you develop heart attack, did you develop BP sugar problem or not? So based on this Framingham Heart study, now we know everything about why heart attack occur, what are the risk factor for heart attack. That was the main topic of the study, but it detected everything about hypertension, diabetes and all. So this is one cohort study. Next cohort study is Doll and Hill study. So 2 times they have asked question from here. Framingham Heart study is an example of which study? This is an example of cohort study. What is Doll and Hill study? It proves that smoking causes cancer. Before this study, public smoking was allowed. When this came, then public smoking became banned. So these all are famous example of cohort study. Chalo. Next question is that Indradhanush scheme is for which thing? Is it for changing bed sheet 7 days, 7 different color bed sheet in government hospital, or is it for vaccination? Whenever I discuss this topic, all the student answer vaccination. But vaccination is mission Indradhanush. This is different than Indradhanush scheme. And mission Indradhanush initially started for only 7 diseases. That's why it is rainbow. Indradhanush means rainbow. Initially for 7 diseases. What were those 7 diseases? Very easy to remember. One are DPT. So 3 are in DPT. Then 3 diseases which are given, vaccine are given at birth. BCG, Hep B and OPV. And last disease was measles. So it was started for these 7 diseases. That's why rainbow. But now it is not Mission Indradhanush anymore. We call it intensified Mission Indradhanush 5.0. You know? They keep changing the number without changing anything inside it. But they just give an updated version. So it is intensified Mission Indradhanush 5.0. And this new program cover all vaccine of national immunization schedule. It has not just 7 vaccine, but it has every other vaccine also, which is in national immunization schedule. So this was old thing. Now Indradhanush scheme, what they are doing, they are giving 7 days, 7 different color bed sheet. Where? In Nikhil bedroom? No. In government hospital. 7 days, 7 different color bed sheet. This is Indradhanush scheme. Okay. Now, next question is, as per SDG, Sustainable Development Goal, what is the target for neonatal mortality? Can anybody answer it? Please do post it in the chat box of our YouTube thing. Is it less than 70 per lakh live birth? Is it less than 25 per thousand? Is it less than 12 per thousand? Is it less than 10 per thousand? What is the answer? What is the target for neonatal mortality? So Sustainable Development Goal, which was given in 2016, has to be fulfilled mostly by 2030. They have these target. I am waiting for your reply also. They said that the accidental death, whatever death is occurring by road traffic accident and other accident, should come to half by 2020. Okay. And all the cardiovascular disease death, like BP, sugar death, cardiovascular death, which is premature. Premature means any death which occur in less than 70-year people is premature death. So the one more criteria was premature cardiovascular death should be 1/3 as compared to 2015. So cardiovascular death 1/3, accidental death half. And this premature cardiovascular death was to be decreased 1/3 by 2030. Other than this, the 3 other target was very easy to remember: 70, 12, 25, 70, 12, 25. That's why a lot of students answered A, because again and again they ask about this less than 70 per lakh. This is not target of neonatal mortality. This is target of maternal mortality. You have remembered the question of previous year without understanding it. So this is for maternal mortality ratio. This target should be 70 per lakh for MMR. For neonatal, the target is 12, less than 12 per thousand. And less than 25 per thousand is the target for under 5 mortality. तो आपको 3 वर्ड क्या याद करने हैं? 70, 12, 25. The 3 digit you have to remember is 70, 12, 25. And it's very easy to remember. 25 under 5. See, 5 and 5. 25 under 5. And then if you do half of 25, it's 12. So 25 under 5, 12 is neonatal, and 70 is for maternal mortality ratio. Other than this, what are the 2 more target? Cardiovascular death 1/3 by 2030 and accidental death half by 2020. If they ask one more target, last target of Sustainable Development Goal was to eliminate TB not just TB, eliminate TB, HIV, and all neglected tropical disease by 2030. Actually, in all these sustainable development goal meetings, na, they give free wine and beer only, healthy drink to get high. So they drink and then they throw big thing. So in the end, they say that by 2030, every disease which is infectious disease should be eliminated. And this is the effect of getting free alcohol. What is neglected tropical disease? All the diseases which occur in India and African hot area, like leprosy, sickle cell anemia, worm infestation, TB, HIV. These diseases they mainly want to eliminate. HIV is not neglected tropical disease, but other than HIV, all the diseases which are in hot climate area, they have to be eliminated by 2030. They are neglected by US, UK, so they call it neglected tropical disease. Okay, so this is by 2030, and only one goal was for 2020, accidental death half by 2020. And in 2020, due to COVID, accidental death actually became half. So all the SDG leader, they said, देखा बोला था ना कर लेंगे, है ना, we said we would have achieved. So remember this as a mnemonic, that only one target was achieved only for 1 year. What was that? Accidental death half by 2020. Okay, so these all target they keep asking, do remember it. Next question is, ki enhanced sickness benefit is for how many days? Is it for 91 days, 7 or 14 days, 2 year, 26 week? Do reply. In the last question, Dr. Shubhra Das, Dr. Bala Bhaskar, and Dr. Nazar, they all replied correctly. Thank you so much for giving correct answer. You all three were right. Chalo. Yes, I will update. If anything has changed recently, I will update that also. Next question is it 91 days, 7, 14 days, 2 year, 26 week? What is enhanced sickness benefit? Give me the reply. Yeah, replies is coming 91 day. A. 91 day is sickness benefit. Not extended sickness benefit, not enhanced sickness benefit. Sickness benefit is 91 day. Any other answer other than A? A is wrong. 2 year. So they have asked one more question from this part, which I will ask in this part. What is the duration of maternity leave under ESI? What is the duration of maternity leave? Is it 24 week? Is it 26 week? Is it 30 week? Or is it 20 week? 24 week. What is the duration of maternity leave? Maternity benefit leave. And let me explain these two questions to you. No one, yes, Dr. Mahadev, Dukhia, Nazar Mas, they all are answering 2 year. 2 year, this was one of the NEET PYQ. This is extended sickness benefit. Extended sickness benefit is given for 34 registered disease only, for all those disease which is seriously, which can affect the health of the employee seriously. And this extended is for 2 year, where we give 80% of salary. But sickness benefit is of only 91 day, and in this we give 70% salary. Less salary in sickness, more salary in extended sickness, because here person is more seriously ill. Enhanced sickness benefit, no one has replied till now. This answer is 7 or 14 day. Why we give enhanced sickness benefit? For cutting your wire, tubectomy or vasectomy, we do give it. Now you tell me, which one is more easy to do? Tubectomy or vasectomy? Of course, in vasectomy, things are already hanging down. नीचे पहले से ही लटक रहा है, छोटा सा कट मारो, कट जाएगा vasectomy. Vast difference we cut 1 centimeter in vasectomy. So for vasectomy, less leave is needed, 7-day leave, and 14-day leave is for tubectomy. And how much salary you get? 100% salary, because you are cutting your wire for the country. देश के लिए तार कटवाए हो. So of course for family also. So do remember, 7 or 14 days enhanced, 91 days sickness, extended is 2 year. And now let me see how many answer. 26 week. Very good, Dr. Mas, Dr. Balas, Bhaskar, Savan, all of you are right. Maternity benefit is 26 week, because it is actually 6 months. But in 6 months there is 28 day plus 2-3 extra day, na? Because in a month there are 30 days. So 28 plus 2-3, that means 4 weeks is everywhere. 4 into 6 month is 24 week. But this 2-3 day will also be repeated by 6. So this will make approximately 12 to 18 day. That means 2 week. So 24 week plus 2 week, total duration is 26 week for maternity benefit. Okay. Chalo. Next question was, where will you throw the plastic bag? Very good. Dr. Nazar was also right. Dr. Som Subra Das is also right. Where will you throw the plastic bag after blood transfusion? Tell me, what is your reply? Plastic bag after giving injection. IV injection. These two questions they have asked. And there is one more answer. Urine bag. Plastic bag is urine bag also. Plastic urine bag. Where will you throw plastic urine bag, plastic bag after giving IV injection, and plastic bag after blood transfusion? 3 questions are there, which they keep asking in a confusing way. So as we all know, everything made up of plastic and contaminated with infection go to or red color. So urine bag goes to red. Now blood transfusion is usually done less as compared to the need of urine bag. Blood bag is needed less, transfusion is less, but catheterization we do in every ICU patient, CCU patient, a lot of patient. So because urine bag are large in number and they are less infectious, so we autoclave them and recycle them. But blood bag, they are less in number and blood bag is very infectious. So blood bag we directly burn in incinerator plant. And how we burn them in incinerator plant? By putting them first under yellow category and then burning them in incinerator plant. Now when it comes to plastic bag after giving IV injection, plastic bag after giving IV injection is not a biomedical waste. It is just a garbage, and all garbage goes in black category. So this will go in black, urine bag will go in red, but blood transfusion bag will go in yellow. और इसको ऐसे याद कर सकते हो, लाल में पीला, पीले में लाल. Red in yellow, yellow in red. Like this you can remember. Red urine, yellow urine goes in red bag. Red color blood goes in yellow bag. Okay? Because we don't want to burn a lot of plastic. Because when you burn plastic in incinerator, it will produce not only pollutant but polyvinyl chloride also. So we are not throwing every plastic there. We are not throwing urine bag there because it will be a lot of pollution and polyvinyl chloride, which will cause hepatic cancer. So we are separating urine bag from blood bag. Okay. So I hope you remember all the 3 and you have given correct answer here. Now let me ask you some more confusing question, which we do mistake again and again. Where will you throw vaccine ampule? Where will you throw broken vaccine vial? Where will you throw culture plate? These are 3 confusing area of question. And where will you throw needle with fixed syringe? 4th area of confusion. So let's revise this whole topic very quickly, and it's very simple. Vaccine ampule or broken vaccine vial, they go in the same blue category. If they would have written that there is an ampule, of course glass ampule, with cytotoxic drug, it is clearly written in PARC that only cytotoxic drug ampule goes in yellow. Rest all ampule goes in blue. What are the 6 things which goes in yellow? Suppose I went out after taking class and a truck went on both of my leg. So when I will brought to your OT, you will cut my leg, throw my anatomical waste in yellow category, and you will left some part hanging in between. All the liquid which will come out, blood and all, you will throw that also in yellow category. Then the bedsheet will get soiled. Soiled means dirty. So you will throw dirty waste, cotton, etc. in yellow also. Then you will give me some medicine, and the medicine which got expired, those expired drug and medicines or vaccines, these all will go in yellow. 5th category is microbiological waste. You will take my blood or something for culture so that you can decide the antibiotic and all. So that culture medium and culture plate, both will go in yellow. And last thing is cytotoxic drug. So what are the 6 things? Anatomical, liquid, soiled waste, expired medicines, microbiological and cytotoxic. 6 thing goes in yellow. ये छो के छो आपकी जुबान पे ऐसे होने चाहिए कि कोई बोले तो एकदम थूक की तरह निकले, है ना? इट शुड बी ऑन योर टंग, इट शुड कम आउट रेडली लाइक sputum, okay? And when they say needle with fixed syringe, this will go in white. White, they say, is for sharp object, but sharp object is also scissor. Will you throw scissor in white? No, because scissor we can reuse. So scissor or any metallic instrument, they will go even if they are sharp. All metallic instrument which are sharp goes in blue, because in blue category we will first sterilize them with autoclave, then we can reuse them, and we don't want to throw scissor and all. So not every sharp thing goes in white. In white only 4 thing goes. One is needle with fixed syringe, second is all other kind of needle, sorry, syringe with fixed needle is one thing, all kind of needle, then scalpel goes here and blade goes here. Scalpel is also an instrument, but in this scalpel instrument you cannot remove the blade and we cannot reuse the blade also. So here we throw it in white, because in white category after you throw it, we shred it into fine pieces and then we discard it. And so here we throw all those things in white only which we have to permanently discard. So do remember white, blue, you already remember red and yellow. I hope you will remember it. Now, next answer this question. Maximum work hour per week per person under Factory Act, how much? If they ask per day, not per week, per day answer will not be 8 hours, it is 9 hours. Park has written 9 hours, including 1 hour break. Okay? Per week. And if they are asking maximum work hour, what is the answer? Is it 48 or 60? Answer is 48 hours. But if they have written maximum work hour including overtime, then answer will be 60, because overtime maximum you can do is 2 hours. And let's calculate it. It's very simple to understand. 8 hours per day we can work if you remove 1 hour of break, and in a week we can work for 6 days. So 8 hours into 6 days, maximum 48. But overtime, how much we can do? Overtime we can do of 2 hours. 8 plus 2, 10 into 6 you will do, how much it will become? 60. So if they use the word overtime, only then you will answer 60. If they have not written overtime, you will answer 48 hours. And per day, if they ask, 9 hours. Okay. Next question is that, very good, 60 and 48 was the answer coming out. I hope it is clear. Overtime 60, without overtime 48. Now next question is, patient have cough, sputum negative, AFB negative. That means AFB is Jaden smear, acid fast bacilli, which are leprosy and TB. So leprosy and TB is not there. It looks like from Jaden smear report. But X-ray is showing TB. So what is the next thing which we do in our national TB elimination program? What is the next thing which you will do? So if someone is not positive on Jaden smear, but X-ray is suggestive, we directly do which thing? Tell me. We directly do CBNAT, cartridge-based nucleic acid amplification test. Okay? 2-time ask NEET question. Second point is that in 5 cases, we don't do Jaden smear, we directly do CBNAT. What are those 5 cases? This question has asked in HIV, what is the first test of TB? First test of TB is CBNAT. Second is, of course, diabetes mellitus, directly CBNAT. Then there is COVID-19, directly CBNAT. Then previously treated TB, directly CBNAT. And final is the pediatric TB suspect. देखो बच्चों को तुम भी जानते हो, बोलो कि बच्चों को कि थूक दो तो मुद देंगे, बोलो कि मुद दो तो थूक देंगे. तो बच्चों से थूक निकालना बहुत मुश्किल है. It is difficult to collect sputum from children, because if you ask them to spit, they will urinate. Ask them to urinate, they will spit. So whatever sample we have collected by difficulty or sometime by gastric lavage, we don't want to waste it on Jaden smear. So we directly do CBNAT. In previously treated TB, maybe these patients are drug resistance, and CBNAT have this advantage that it detects TB plus it also detects rifampicin resistance. And if anyone is rifampicin resistant, then we can directly start MDR TB treatment. But in NEET exam, they have asked this question that what is the definition of MDR TB? So if they ask the definition of MDR TB, MDR means there should be resistance to isoniazid and rifampicin, both H plus R, minimum these two resistance hona chahiye. And what is the new treatment which they subscribe for MDR TB? This is known as B-palm-razine, which is approved by Government of India in this year only, and this is expected in your exam to come. In 6 to 9 months, you can be free from TB. B stand here for bedaquiline, P stand for pretomanid, L stand for linezolid, and M stand for moxifloxacin. So they will ask which of the following drug is not included in newer B-palm regime, and they will give one option, levofloxacin. So levofloxacin is not included. L for linezolid is there, and then moxifloxacin, pretomanid, bedaquiline. And they can ask what is the mechanism of action of bedaquiline. Bedaquiline is an ATP synthetase inhibitor. It prevents the synthesis of ATP, and because of this, bacteria become energyless, life loss, and die. Okay, so it is ATP synthetase inhibitor. So do remember these two definition and treatment of MDR TB. And do remember, in 5 cases, HIV, diabetes, COVID, previously treated pediatric TB, we directly do CBNAT, no Jordan smear. Chalo, next question was that in a receiver operating curve, what are on X and Y axis? What is receiver operating curve? They can give an image based question from here. Suppose you want to know what is the cutoff for fasting blood sugar. We all know cutoff is 126, but how we got this cutoff? Did this cutoff fell from the sky? No. All the cutoff of any test, if you want to find the cutoff of any test, the curve which we use is known as ROC curve. What is full form of ROC? Receiver operating curve. So how we find cutoff for any test, let's say blood sugar? First, we take 200 people, do their HbA1c. So now we know which one are really positive, which one are not positive. Here now you will write how many people are really positive, true positive rate. How many are actually disease and also positive. बीमार भी हैं और positive भी है, they are true positive rate. And true positive is known as sensitivity. Because what is the formula of sensitivity? If you see, sensitivity is true positive out of disease. बीमार लोगों में से जितने लोग पकड़े गए उसको कहते हैं सेंसिटिविटी, है ना? Correct positive out of total disease, how many are caught, that is sensitivity. So when you see in the disease part, there are 2 type of people. First, whom we are able to catch, true positive, and second, who we were not able to catch, they are miss out, they are false negative. बीमार 2 तरह के लोग होते हैं, एक जो पॉजिटिव आ गए और एक जो गलती से निगेटिव आ गए. बीमार थे लेकिन हम उनको पकड़ नहीं पाए, गलती से निगेटिव आ गए, दे आर फॉल्स निगेटिव, है ना? रॉन्गली निगेटिव और फॉल्स निगेटिव. So disease is true positive, false negative, and therefore remembering the formula of sensitivity is very easy. You just remember true positive. In the denominator, there is again true positive, and then just opposite of true positive. Opposite क्या है? True का opposite क्या होता है? False. Positive opposite negative. तो अगर आपको एग्जाम में सिर्फ इतना याद है कि सेंसिटिविटी में ऊपर ट्रू पॉजिटिव होता है, तो नीचे ट्रू पॉजिटिव उसका जस्ट उल्टा लिख के आप फॉर्मूला हमेशा बना लोगे. True positive is in the numerator, you can easily remember, and denominator is true positive and just opposite false negative. And sensitivity is true positive rate, this is the formula. Then we compare true positive with false positive. False positive rate is known as 1 minus specificity. And what is the formula of specificity, they ask. In 2 of the NEET exam they have already asked. स्पेसिफिसिटी का मतलब होता है निकाल के बाहर करना. जितने लोग बीमार नहीं थे, नॉन डिजीज, उसमें से कितनों को आपने सही सही निकाल के बाहर कर दिया. स्पेसिफिसिटी इज एबिलिटी टू एक्सक्लूड आउट ऑफ ऑल द पीपल हु आर नॉट हैविंग डिजीज, हाउ मेनी यू वेर करेक्टली रिमूविंग, हाउ मेनी यू वेर ट्रू नेगेटिव, दैट इज स्पेसिफिसिटी. एंड आउट ऑफ पीपल हुम यू आर रिमूविंग, one are those which you are correctly removing, one are those which you should have removed but you wrongly gave positive report. They are also non-disease. Non-disease बीमार नहीं लोग दो तरह के होते हैं, एक जिनको निकाल दिया आपने ट्रू नेगेटिव बोल के, एक बीमार नहीं थे, गलती से आपने पॉजिटिव दे दिया, फॉल्स पॉजिटिव. So if you have to remember the formula of specificity, again it is very easy. Just remember true negative. In the denominator again there is true negative and just opposite of that. What is the opposite of true? False. What is the opposite of negative? Positive. So true negative by true negative plus false positive, and we can always remember it. And if you want to get answer in percentage, you can multiply by 100, not compulsory. So always remember these two formula. Now in ROC curve, suppose I want to know what is cutoff for fasting blood sugar, and I started with fasting blood sugar 90. So at 90 fasting blood sugar, many of you people will also come diabetic because your blood sugar is definitely more than 90. Which type of positive you will be? You will be false positive. And then people like my mother who is actually diabetic, her blood sugar is also more than 90. So true positive will also come more. So 20 people are really diabetic, true positive. 20 people are like you, young student, who are not diabetic, wrongly came positive. So this test, which is at 45-degree angle, this is a useless cutoff. Rather than using this cutoff of 90, we can toss a coin. Head come, diabetic. Tail come, non-diabetic. That will also give me 50-50 result. So this is a useless cutoff. We should not use it. Then we move ahead. Suppose next cutoff we use is 110. This 110 is better because true positive is 20, false positive is only 10 now. So 110 is better cutoff. But if you go a way more up, you will get 126. At 126, true positive is 20 and false positive is hardly 2. So what is the ideal cutoff? Ideal cutoff is 126. Ideal cutoff have maximum slope. This maximum slope, topmost curve, is ideal cutoff. And why it matter? The slope, because slope of this curve tell about positive likelihood ratio. So what does ROC curve tell about? ROC curve tell about positive likelihood ratio. What is positive likelihood ratio? Positive likelihood ratio means कि two type of positive are there, true positive and false positive. So how many are true positive as compared to how many are false positive? And we can see true positive is on y-axis, false positive is on x. So y by x is the slope. Basically, इतना serious होने की बात नहीं है. In ROC curve, they can give three type of question. First question, image-based question. Can you identify this type of image? Slope going above? Yes. This is ROC curve image. What is the use they can ask? It is used to find cutoff for a test. Third thing they can ask is, in this graph, which cutoff is best? So the cutoff with highest slope is the best. Why cutoff with highest slope is best? Because ROC curve slope tell about positive likelihood ratio. And what is positive likelihood ratio? Correct positive divided by false positive. True positive by false positive is positive likelihood ratio. If we are doing some sugar test, how many are really disease, true positive, how many are wrongly positive, we compare that using ROC curve. So this is ROC curve which give us cutoff by giving us positive likelihood ratio. Okay, so these are 3-4 questions which can come from here. I hope you will remember. In the ROC curve, which thing is correct? Is it between specificity and 1 minus sensitivity? No, it is between sensitivity and 1 minus specificity. Na? So it is sensitivity by 1 minus specificity. Area under curve equivalent to likelihood of a negative result? No, no, no. Area under curve is equivalent to likelihood ratio of a positive test. Area of that curve tell about positive likelihood ratio, not negative likelihood ratio. है ना? And this is between sensitivity and 1 minus specificity. है ना? You can see it. It is between sensitivity and 1 minus specificity. And it is telling about positive likelihood ratio. Okay. So I know this is a new topic for some of you, but it has been asked in INI-CET and NEET, so we should know it. Next is about confounding factor. What is confounding factor? It's very easy to understand. Let's say a boy proposed to a girl. And what do you want? Girl should accept or reject? And let's have happy ending. Girls accepted the proposal. So in this story, boy proposal is the reason, exposure, कारण है कि लॉन्डे ने प्रपोज मारा, और गर्ल एक्सेप्टेंस इज द आउटकम, ये है परिणाम, कि बंदी ने बोला कि हट पगले, पहले क्यों नहीं बोला, मैं कितना इंतजार कर रही थी 2 साल से, बोलता ही नहीं था तू. So the boy proposed and girl said, why you didn't said earlier, I was waiting for your proposal. So this is exposure, this is outcome. Now in this story there are 2 type of friend. One friend are common friend who know boy also, who know girl also. So because they know both exposure and outcome, both boy and girl, this type of friend are known as confounder. Confounder वो बीच वाले दोस्त हैं जो एक्सपोजर से भी जुड़े होते हैं, आउटकम से भी, है ना, लड़के को भी जानते हैं, लड़की को भी. Confounder are those common friend which knows both. Then there are only girlfriend also, which will tell something to the girl like, hey, I have seen your boy roaming around with other girl and you also roam around with other boy, so you will be good together, है ना. So he will say something which will make the proposal acceptance or reject the proposal. So this only girlfriend are known as effect modifier because they are only connected with the outcome. They are not related with the exposure. They are effect modifier. And confounders have 3 criteria. First criteria, they are related to both exposure outcome. Second criteria, confounder is unequal in 2 group. It is not equal. Even effect modifier is also unequal in 2 group. And last criteria for confounder is that confounder and effect modifier, both the things, both are unequal in 2 group and both do not come in causal pathway. Do not come in causal pathway means even without confounder and effect modifier, same outcome can occur. Like for example, let's say Tinder and other dating app. Boys swiped, girl swiped. We don't need a common friend or a girlfriend there on Tinder account. There is no rating like 5-star rating. This boy performed really well, accept his proposal like that. No, there is no feedback. There is no common thing. Boy can propose, girl can accept. So even without them, same thing can occur. That means they are not necessary. They are not coming in the causal pathway. Even without them, same thing can occur. So this is confounder effect modifier concept. I hope you will remember confounder is related to both. Now the question is, how can you remove confounder? How can you eliminate it? Second question is, I have written they are unequal in the 2 group. How they are unequal in 2 group? So there are 2-3 questions which come from this topic. Let's understand it with a very simple example. Suppose someone of you took gynae and they got a lot of money from pharma company which say that prove it to us that OCP causes less breast cancer and we will give crore of rupees to you. So you can connect a PSM person like me, ask me how to prove it and we will give you some thousands of rupees. So I will tell you that make 2 group, one group who are OCP user, other group who are non-UCP user. In the OCP user group, take only young female who are between, let's say 20 to 35 year. They are young female, young age. And because they are young age, so they will have one group. And in the other group, take only those who are between 35 to 55 year old age. Because they are old age, definitely they will have more breast cancer because of old age. And when one group has more breast cancer as compared to this group, other group will have less breast cancer. जब बूढ़ी औरतों का एक ग्रुप होगा, हालांकि बूढ़े नहीं है, थोड़े बड़े हैं, तो इन बड़ी औरतों में ब्रेस्ट कैंसर ज्यादा होगा. तो इनके मुकाबले अपने आप ये प्रूव हो जाएगा कि ओसीपी वालों में ब्रेस्ट कैंसर कम हो रहा है. Okay, because one group will have more breast cancer, automatically other will be comparatively less breast cancer. So in this story, you can see the age which we are talking about, this old age or young age, the age is related to exposure also. What is the exposure? Exposure is OCP use or exposure is OCP use. And what is the outcome? Outcome is breast cancer. Now, this age is related to exposure also. Due to this young age, they are taking OCP, and due to young age, their breast cancer is less. So this age is the confounder. Why age is confounder? Because one reason it is related to both exposure and outcome. Second reason, even without the age effect also, maybe OCP can cause less breast cancer. So it is not coming in the pathway. Third reason is confounder is unequal in the two group. One group it is young people, one group it is old people. So it is not equal, it is unequal in two group. Okay. Anyway, nature everything is unequal. No two finger is also same. So right finger is more strong than left finger. So it is also unequal. Okay. So this is confounder. Age is confounder here. Now the question they keep asking, how will you remove this effect of age? How will you remove confounder? So the best method, one of the best method to remove confounder is by randomization. And even better than randomization is, best method is stratified randomization. Second best method is randomization. Third best method is matching. So what is this? Three things: stratified randomization, randomization, matching. They are the way to remove confounder. Let me explain them very simply. Randomization means you are asking all the young and old female to come together and choose chit by lucky draw. If you choose chit A, you will get the OCP group. If you choose chit B, you will go to the non-OCP group. So it is randomly you are putting them in the two group. Because you are randomly putting, now you cannot have young people in one group, old in other. So now they will get mixed. So due to randomization, young and old will get mixed and their young old age effect will go away. Second thing is matching. Matching means if you are in the OCP group giving it to a 37-year female, in the non-OCP also give it to 37-year female. So if you take same age group, then both will be of same age group, young and old will not be there, confounder will become equal and the effect of different age will go away. So that's how randomization and matching remove confounder. But what is stratified randomization? See, strata word means layer. So this time, if you are matching one by one, 37, 37, this is matching. But if you are taking, let's say 5 female who are between 35 to 37 in this group and 5 female who are between 35 to 37 here. So now you are not matching single, you are matching in a layer, matching in a group. So when they say stratification or stratification means again you are matching, but you are matching in group. आप एक एक करके 37 साल के लोगों को मिला के नहीं ला रहे हो. अगर एक एक करके मिलाते तो मैचिंग होता. आप 5-5 फीमेल को मिला दिए, मैचिंग ग्रुप में कर दिए 5-5 के, कि इधर भी 35 से 37, इधर भी 35 से 37, तो उसको कहेंगे स्ट्रैटिफिकेशन. लेयर बना के आपने मैचिंग किया. और स्ट्रैटिफाइड रैंडमाइजेशन का क्या मतलब है कि पहले आपने लेयर बना दिया कि 35 से 37 साल की 10 फीमेल आएंगी और उसमें से 5 जो ए चिट चूज करती हैं वो ओसीपी ले लेंगी, 5 जो बी चिट चूज करती हैं वो नॉन ओसीपी ले लेंगी. तो आपने एक लेयर पहले बना दिया, 5 फीमेल टोटल 10 मिला के 35 से 37 साल का लेयर बना दिया और लेयर बना के लॉटरी मेथड किया. यानी पहले स्ट्रैटा बनाया फिर रैंडमाइजेशन किया. तो इससे क्या होगा कि गारंटी चांस है कि दोनों तरफ 35 से 37 साल की ही फीमेल जाएंगी. तो रैंडमाइजेशन में तो फिर भी चांस है कि जवान एक तरफ बूढ़े एक तरफ कुछ जा सकते हैं, लेकिन जब लेयर बना के फिर चिट चूज कराएंगे तो बिल्कुल चांस नहीं है कि जवान बूढ़े अलग अलग जाएंगे. तब तो मिक्स हो ही जाएंगे और मिक्स होते ही ये जो इफेक्ट है उम्र अलग होने का वो चला जाएगा. यानी मिक्स होते ही कंफाउंडर चले जाएंगे. तो हम मिक्स कैसे कैसे कर सकते हैं? स्ट्रैटिफाइड रैंडमाइजेशन से, रैंडमाइजेशन से, मैचिंग से. एंड देन वन मोर मेथड, फोर्थ मेथड इज स्ट्रैटिफिकेशन. ये भी एक मेथड है कि हम लेयर बना बना के मैच करेंगे तो भी जो कंफाउंडर्स हैं जैसे उम्र वो मिक्स हो जाएगी और मिक्स होने से चली जाएगी. सो व्हाट आई वाज सेइंग इन हिंदी ये वाज कि स्ट्रैटिफाइड रैंडमाइजेशन और स्ट्रैटिफिकेशन मींस we are matching them in group, 5 female of 35-37 here, 5 female of 35-37 here. Now if you match them 5-5 and bring all the 10 female together and ask them to choose by lucky draw, then any 5 can go in A group, any 5 can go in B group. So what you are doing, you are choosing 10 female of 35-37 year. You are first creating a strata, then asking them to choose randomly, then doing lottery method. So it is stratified randomization. It is better than randomization because here there is no chance that young and old age will go differently. Here they will definitely get mixed, and if they get mixed, effect of young and old age will go away. So what are the four methods to remove confounders? Stratified randomization, matching, and stratification. Why this topic is important? Because sometimes they ask it from confounders, sometimes they ask it from selection bias. If you are selecting young people in one group, old in other, it means you are doing wrong selection. अगर एक तरफ जवान एक तरफ बूढ़े चुन रहे हो तो चुनने में गलती है. चुनने में गलती को selection bias कहते हैं. Choosing wrong people in two group is selection bias. So here we are also doing selection bias by choosing young and old group. And they can ask this second question also: how will you remove selection bias? So the same four method which are removing confounder, they will also remove selection bias. Okay, there are two more method, but we don't know to go there. But mainly four methods, other methods are also there. So do remember, both selection bias and confounder goes away by these four work. Both selection bias and confounder are removed. Two things are removed, है ना? Because you understand the point. Chalo, now, so what is the question? Question is, confounder can be eliminated by all except which do not remove confounder or which do not remove selection bias. So selection bias or confounder can be removed by matching, can be removed by randomization, can be removed by stratification, but it cannot be removed by blinding. Blinding only remove researcher bias. Researcher bias is also known as interviewer bias or observer bias. See, what is researcher bias? Researcher bias simply means that suppose that gynae JR who have got crore of rupees from OCP company, if he know that who are taking OCP, who are not taking OCP, if he know the result, and suppose that gynae doctor, he already think that OCP will reduce breast cancer, it means he had already made his mind. So now what will happen? In the OCP group, he will not do mammography every month. He will do it once in a year. But in the non-OCP group, he will do mammography every week because he think in the non-OCP, there is more chance of breast cancer. So if the researcher already know what are the two groups, he can manipulate the data. But if the researcher is blind, then he cannot manipulate the data. Blinding will remove the bias of researcher. Okay? What I was saying in English was कि अगर जो गायनी के डॉक्टर को रिसर्च करना है उसको पहले से पता है कि ओसीपी कौन ले रहे हैं, नॉन ओसीपी कौन ले रहे हैं, और वो पहले से ये सोच के बैठा है कि ओसीपी लेने वालों में तो ब्रेस्ट कैंसर कम ही होगा, तो वो क्या करेगा? ओसीपी वालों का तो मैमोग्राफी साल में एक बार कराएगा, नॉन ओसीपी वालों का मैमोग्राफी हर महीने कराने लग जाएगा. इससे क्या होगा? नॉन ओसीपी में थोड़ा सा भी ब्रेस्ट कैंसर आएगा तो डिटेक्ट हो जाएगा और वो जबरदस्ती प्रूफ कर देगा अपनी बात. तो जो रिसर्चर होता है वो अपनी बात जबरदस्ती मनवाने लग जाता है. इसको हटाने के लिए हमें क्या करना चाहिए? रिसर्चर का अखवा फोड़ देना चाहिए, रिसर्चर को ब्लाइंड कर देना चाहिए. तो अगर इफ देयर इज ब्लाइंडिंग, रिसर्चर डोंट नो which group is OCP user, which group are non-user, and that will remove bias of researcher. So blinding will remove researcher bias and confounder selection bias are removed by these three methods. This is a very common area of question in NEET exam, and I am expecting it to be in this time July FMGE exam. One more question on this topic was कि drinking, this was NEET PYQ, drinking cold water lead in gym, drinking cold water in gym while doing exercise lead to more weight loss. अगर जिम में जाके ठंडी ठंडी बियर नहीं पानी पिएंगे आंखें खींच के मीच के तो उसके चलते वेट कम हो जाएगा, है ना? ड्रिंकिंग कोल्ड वाटर इन जिम लीड टू मोर वेट लॉस. ये कैसा एसोसिएशन है? ये कैसी बात है? दिस रिप्रेजेंट, ऑप्शन ए, डज दिस रिप्रेजेंट स्प्यूरियस एसोसिएशन? क्या ये बात झूठी है? स्प्यूरियस मींस फॉल्स, रॉन्ग एसोसिएशन. सेकंड थिंग है, इज इट डायरेक्ट एसोसिएशन? क्या ये सीधी बात है कि ठंडा पानी पीने से तो वेट लॉस होता ही है, सीधी बात, या क्या ये इनडायरेक्ट एसोसिएशन है? Indirect association means confounder or effect modifier. Indirect association is of two types, confounder, effect modifier. And I hope you remember, confounder is related to both exposure outcome, effect modifier is only related to outcome. So what is this? Spurious, direct or indirect? देखो, direct has a very good example. Confounder effect modifier, we already got the example of OCP user, non-user, boy proposer, girl acceptance. This all example we have discussed. But direct association example is like, let's say we can say that if there is streptococcus infection will cause sore throat. So this is direct. There's nothing indirect thing. This is directly occurring. So this type of thing is direct. Indirect, confounder effect modifier. And this type of thing, cold water lead to weight loss, this is actually useless, spurious association. Okay? Because drinking cold water can lower your core body temperature. And to increase the core body temperature, you can lose some calorie. But there is two research already done on this topic. The calorie which is lost to bring back your core body temperature is very small, insignificant. So this type of thing is spurious association. It's not correct. Okay? Sure. Next question is, before that, one question was missed. This question was, which of the following is not a disturbing influence of Hardy-Weinberg law? This is one area which they used to ask a lot of questions. They have removed for some time. I'm expecting it to come this exam. What is Hardy-Weinberg law? It simply says that if you add all the recessive gene, all the dominant gene, and all the hybrid gene, total will become 1. The gene pool of a population remain equal to 1. But this gene pool of 1, gene pool remain constant. This is Hardy-Weinberg law. Ki gene pool remain constant equal to 1, except there are some condition which disturb the gene pool. First condition which disturb the gene pool is mutation. If there will be mutation, like X-Men, some new species can come, gene pool can get disturbed. Second is migration. People going out or new people coming in, like Aryan people came to India, so then we had a new gene after that, after Aryan invasion theory. So mutation, migration can disturb Hardy-Weinberg law. Then if there is natural selection, by natural selection also some gene are removed, some gene are added. Then if there is selective mating like it is found on observing the bone fossil fuels of Indians, that around 1300 BC, 1300 like 800 year back, all the intercaste marriages were approximately stopped and only caste-wise marriage are occurring in India. So if you do only caste-wise marriage, some gene will go away, some gene will not be there. So selective mating will remove the gene and that will disturb the gene pool. So gene pool is disturbed in which correct criteria? Mutation disturb gene pool, migration, natural selection, and selective mating. Other than this, sometimes some government step, like Hitler did not allow some disabled people and other people to have sex or have children. So this type of government decision to allow breeding of some people or not allow breeding of other people can also affect gene pool. So 5 method can affect gene pool. But if there is random mating means it doesn't mean anyone is doing sex with anyone. Random mating means marriage can occur between caste. Randomly anyone can marry anyone. Then gene pool will become normal. Selective mating will disturb it. So do remember 5 things disturb Hardy-Weinberg law: mutation, natural selection, migration, government decisions, and selective mating. Random mating do not disturb Hardy-Weinberg law. Do random mating. Okay. Chalo. Now next question is, there was one more question on this topic which I discussed in one of the class, that if you are using some Down syndrome children and you want to improve their IQ. So Down syndrome children were getting good education, given good training or good education, like in Sitare Zameen Pe, Amir Khan movie. So if you are giving good education to them, it is example of which thing? Is it example of positive eugenics, negative eugenics, or positive euthenics? So this is an example of positive euthenics. Euthenics means giving them supportive environment so that whatever gene they have, that gene get expressed to its full potential. वाह, क्या मतलब हुआ इसका? इसका मतलब हुआ कि ऐसा माहौल बना के देना कि जीन चाहे कचरा भी हो, जीन में चाहे कोई गड़बड़ी भी हो, फिर भी वो बंदा अपना फुल पोटेंशियल अचीव करे. इसको कहते हैं यूथेनिक्स. So we are doing the same thing here. We are making them good facility, giving them so that they can have better expression of gene. But what is positive eugenics and negative eugenics? They can ask. Positive eugenics is like artificial insemination. If someone want to have child like, let's say, Virat Kohli and all, they can do it, and this is improving the gene. Positive eugenics. And negative eugenics is what Hitler has done. He did not allow some special type of people to breed. So he was also trying to improve the race, but he was doing it in a negative way. So if you are improving genetics, it is genics. If you are improving environment for better expression of gene, that is euthenics. Okay, so I hope you will remember this concept also. Being asked already, so you should know. Chalo, next concept is, during which national program we are looking at developmental delay of child and trying to save it. So I hope you know the answer. When we look at Rashtriya Bal Swasthya Karyakram, RBSK, then in RBSK, Ayush doctor and ASA and Anganwadi, all these three are part of RBSK. They go to either Anganwadi or government school and they screen children for 4D. So they can ask, what are the 4D? Screen for 4D. First D is what is written here, developmental delay or defect, disability. Developmental delay or disability. This is first D. Second D is defect since birth, like my case, and a congenital birth anomaly. Third case is disease of childhood, बचपन की गलतियां नहीं, बीमारियां. और and the last is deficiency disease, बचपन की कमियां. So they can ask question from here which is not included in 4D, and they can put one extra something. So these are the 4D, and who three are the member of it? Ayush doctor, Anganwadi and ASA, all three do screening. Now the question which they ask from RBSK is that two type of question come here. First, Ayush doctor is going without any instrument. So all the disease which need instrument do not come under RBSK. So RBSK not screen for congenital glaucoma, because in congenital glaucoma only 10% case have bluephthalmos. Rest all, if you want to diagnose congenital glaucoma, you need to measure either optic nerve thickness or eye pressure by gonioscope and all. So the instrument is not there, so it do not come. Second thing which do not come is zinc deficiency. This also do not come under it, because zinc deficiency, this question was in INI-CET recent year, कि zinc deficiency के चलते क्या हो जाएंगे, छोटे टट्टे, हाइपोगोनाडिज्म. और आप में से किसी ने कुछ भी नापा होगा, कभी भी आपने एक दूसरे दोस्त के साथ अपने टट्टे नाप के नहीं देखे होंगे कि वाह तेरे तो बहुत बड़े टट्टे हैं. We never measure testicle size among our friend. We can use to measure testicle size only by orchidometer instrument. And Ayush doctor is not going with orchidometer, so he cannot find hypogonadism. Second, which was the question in NEET 2023, that if there is dryness around nose and mouth, this dryness around nose and mouth can be due to zinc deficiency. But this also we never diagnose in any patient. We just apply cold cream. We don't write zinc for such symptom of dryness. And last thing with zinc deficiency, which has been asked in MCI exam, is delayed wound healing. And this delayed wound healing, if you find in any patient, there also you think the reason can be low immunity or more infection, anything. So in all these three symptoms, we never find zinc deficiency. So these two diseases do not come under RBSK. Second thing with zinc deficiency is zinc deficiency can also lead to premature delivery. This is also one more problem with zinc deficiency. Why delayed wound healing, premature delivery, hypogonadism and dryness around nose and mouth occur with zinc deficiency? Because I hope you all know this zinc deficiency lead to acrodermatitis enteropathica, and due to acrodermatitis enteropathica, the intestine is not able to absorb anything. So all the zinc and multivitamins will also not be absorbed when the absorption is not occurring, and that is leading to acro, dryness of skin, dermatitis, and intestine is not absorbing anything. That is why whenever there is loose motion or diarrhea, we always give ORS, but along with ORS we also give zinc. What is the role of giving zinc, they ask? Zinc is needed for regrowth of cilia. Okay, because when loose motion occur, suppose this is columnar epithelium of intestine, all this hair goes away with the loose motion. So when you will give zinc, and this has to be given for 14 days, then this hair will go slowly, the hair will grow, and see, if the hair will grow, absorption area will increase. Otherwise, when the hair are not there, absorption area is so small. So because zinc is causing hair growth of cilia, it need to given for 14 days, and the dose is, if it is less than 1 year, we give 10 mg per day for 14 days, and if it is more than 1 year, we give 20 mg per day. Okay. So these are the questions which they ask from here. You should definitely know them. Next question is that which disease control program, if there is single disease control program, we call it vertical program. Vertical program can be something like TB program. TB program have center TB cell at Delhi, state district TB unit, and after center state district TB unit, there is center state district, then there is tubercular unit, and after tubercular unit there is designated microscopy center, and after designated microscopy center, last thing is drug depot, which only give medicine. So this is the way how TB program function in India: center, cell, state, district, tubercular unit, designated microscopy center, and drug depot. This is totally vertical, only deal with TB. And from this part, there was a question in NEET 2018 exam, that what is the most peripheral unit of TB program having facility of microscopy? So can you give me the answer? Option R, is it district TB unit? You are understanding the question? What is the question? Question is most peripheral unit of TB program, post peripheral unit of TB program, NTEP, National TB Elimination Program, with microscopy facility. Which one have most peripheral unit with microscopy facility? Is it option A, district TB unit, or is it option B, tubercular unit, or is it option C, designated microscopy center, or is it option D, drug depot? Which one is most peripheral unit with microscopy? So what is the answer? Most peripheral unit with microscopy. Oh, this was the zinc question was also in JAM exam. Okay, very January exam. Oh, very common. Very good. Himalayan has given the correct answer, DMC, because in the word DMC, you can see microscopy is written. Actually, most peripheral unit, सबसे कोने में तो drug depot है. Most peripheral unit is drug depot, but it only give TB drug. It do not do investigation. Most peripheral unit with microscopy is designated microscopy center. Option C is correct. Very good, Dr. Himalayan. You are right. Chalo. Now, next question is, vaccine, which vaccine we give during disaster or post disaster, they can ask. So first thing is, whenever there is disaster, we don't stop national immunization vaccination. Don't stop vaccine of child. Whatever vaccine child has to get, we will continue giving them the vaccine. So we can give measles, polio vaccine and tetanus vaccine to children, not to general population. And they have not used the word they have not used the word children. So we don't give everything. Actually, vaccination of tetanus, there are 3 vaccines which we can give to health workforce. We can give tetanus, we can also give typhoid, and we can also give cholera. So we can remember it by the mnemonic TTC. tetanus, typhoid, cholera. 3 vaccines are given to doctors and other people who go to disaster affected area. So this is only given to health workforce, and remember, no vaccine is given to general people. No vaccine to general population during disaster. Okay. So the decision of government of India to give corona vaccination during 2021 wave of corona was against the WHO and CDC guideline, because WHO, CDC, PARC all say that we should not give any vaccine during the wave of corona or during the wave of any disaster. And you have seen it also that during the wave, because government gave vaccine, a lot of death occur by blood clotting, heart attack, and side effect of COVID. And so vaccination of corona should be given when the wave is gone away. Why we should not give it during the wave, during disaster? Because immunity of vaccine takes around 3-4 months to develop. टीका आज लगाओगे और रोग प्रतिरोधक क्षमता 3-4 महीने बाद बनेगी, तो आज लगाने का फायदा क्या है टीका? If the immunity is coming after 3-4 months, what is the point of giving vaccine during disaster? So they say no vaccine during disaster. No means no. TTC we give only to doctor and health workforce. But there is one controversy to it. The controversy which has been asked in MCI exam also, that measles vaccine, this is the only vaccine which give immunity in 7 to 8 days, and symptom of measles come in 10 to 14 days. तो आप बात समझ रहे हो क्या हो रहा है? बीमारी के लक्षण आने से पहले बीमारी को रोकने के लिए हमारे शरीर में सिपाही बन जा रहे हैं. बिफोर द सिम्टम विल कम, we are ready with antibody due to measles vaccination. So at least we can give measles. But why I have written that no vaccine is given? Because do remember, measles is also not given during disaster. Why? Here the reason is that during disaster, measles is not a common disease. So why are we going to give its vaccine? What is the most common disease during disaster? If you see, they have asked this question. Most common disease during disaster is gastroenteritis, charchari, loose motion. The musical sounds which come out in loose motion is charchari. So gastroenteritis is most common disease. Then there can be leptospirosis, and then there can be cholera. After this, there are rickettsial disease, and then there is mosquito transmitted disease. But measles is not a common disease during disaster, so we never give its vaccine. Second thing, doctor and nurses are in limited number, so why engage them in giving measles vaccine, which is not even a common disease? So we don't give any vaccine to common people during disaster. But do remember, this question has come, which vaccine give immunity before symptom come? And second question which has come from here is that in the one of the district of Kerala, leptospirosis was most common in Kerala and Mumbai flood. So when leptospirosis occurred, they distributed the doxycycline drug. But along with doxycycline drug, what is the next thing which they gave? So what in the life cycle of leptospirosis, you will see that leptospirosis is transmitted by rat urine. So we need to kill rat if we want to decrease leptospirosis in Kerala. And to kill the rat, we need zinc phosphide. One very good app wrongly written the answer as malathion. Malathion is needed to kill mosquito. Here we don't need to kill mosquito, we need to kill rat. So we will give rodenticide, which is zinc phosphide, not malathion. And rat urine will be in the life cycle, you will directly diagnose leptospirosis. Plus there was a question from leptospirosis in last MCI only, if there is fever with conjunctival suffusion. Conjunctival suffusion means आंखें लाल हो गई जैसे गांजा फूक के, चरस फूक के हो जाती हैं, और साथ में हो गया काफ मसल पेन. सो इफ देयर इज फीवर, काफ मसल पेन and redness of eye, just as which occur after smoking weed or hash or something like that, conjunctival suffusion plus cough muscle pain plus fever, it is leptospirosis. Rat urine in life cycle, leptospirosis. For preventing other people, we give doxycycline, and for killing rat, we give zinc phosphide. Now, plastic wrapper of syringe, we already discussed. This is without any contamination from body, so it will go in black category. Chalo, next question. This is the question which they keep asking about tetanus. Try to answer this question. Person report 4 hours after having a clean wound and he had taken tetanus 12 years back. So what is the next thing you will do? Option A, full course of tetanus with tetanus immunoglobulin, single dose of tetanus, no need of vaccine, धो के छोड़ दो. Let's create one more option, option E, TT plus tetanus immunoglobulin. So what is the answer out of A, B, C, D, E? Remember, tetanus is a very important thing to revise. If there is history of last 5 year tetanus vaccine, last 5 years someone has taken tetanus, है ना, tetanus in last 5 years. So do nothing, simple, just wash and let the person go home. 5 साल के अंदर अगर टेटनस ले रखा है तो चाहे वो धूली धूसरित गंदा बहुत गंदा सड़ा हुआ घाव हो तब भी टेटनस नहीं देना है. Whether it is lacerated, deeply lacerated, dirty wound, we never give tetanus if last is taken within 5 years. Only wash, to remember. Now, what is the answer to this question? Do give me the answer also. So first thing is, we don't wash, we don't give anything if it is in 5 years. Second point is, F से होता है full course, F से और क्या होता है? हाँ, मुझे पता है तुम F से और दूसरा क्या सोच रहे हो, वो भी होता है, बट यहां से F से है forgotten. अगर कोई आ जाए भूला, suppose someone came and said I have forgotten the last dose, no history is there. If there is no history, only then we give full course of tetanus. Full course forgotten. And this full course of tetanus is given if there is clean wound and patient came in less than 6 hours. Then we will give only full course, no immunoglobulin. And when do we give full dose of TT with TIG? This full dose, as I said, F for full dose, F for forgotten. So full dose is given in forgotten. But if it is forgotten the history of tetanus and the wound is of other category, wound of other category मतलब क्या है? देखो समझो, बहुत आसान है समझने का. 2 कैटेगरी होते हैं घाव के. एक होता है क्लीन घाव जो 6 घंटे के अंदर आ गया, दूसरा है और हर तरह का दूसरा घाव, जैसे गंदा घाव, 6 घंटे से ज्यादा वाला घाव. तो जो घाव क्लीन है, क्लीन घाव में कभी भी इम्यूनोग्लोबुलिन नहीं लगाते हैं. इम्यूनोग्लोबुलिन हम सिर्फ तब देंगे जब अदर कैटेगरी का होगा, गंदा घाव होगा. और फुल कोर्स हम भूलने पे देंगे ही देंगे. तो अगर कोई साफ घाव में भूल गया तो केवल फुल कोर्स देंगे. अगर कोई गंदा घाव है और वहां भूल गया तो फुल कोर्स के साथ इम्यूनोग्लोबुलिन जोड़ देंगे. What I was saying in Hindi was full course is in forgotten, but immunoglobulin is added only if it is dirty wound. Dirty wound is other category wound. If it is not a dirty wound, we don't add immunoglobulin. We only give full course. Okay. Second point is, if someone is within 5 years, we give single dose of tetanus. Within 5 year history, we don't give anything, only wash. But if someone came between 5 to 10 years, no matter which type of wound is there, is it clean or dirty, doesn't matter, we will give single dose of TT. अगर कोई 7 साल में dirty wound भी लेकर आता है, even if it is dirty wound in 7 years, we will only give single dose of TT. Okay. So less than 5 years, nothing. 5 to 10 years, TT. But if someone come more than 10 year history, more than 10 year back, TT or DT taken. So if there is more than 10 year back, then it depends whether the wound is clean less than 6 hours or it is other category. If it is other wound, then along with TT or DT, we also give tetanus immunoglobulin. But in the clean wound less than 6 hours, we give only one sort of TT or DT. Mainly TT we prefer. So what I am telling, let me summarize. Simple thing. If someone come less than 5-year history, then we will only wash, no matter which type of wound is there. 5 to 10 year, we will only give TT or DT, no matter which kind of wound is here. More than 10 year, clean wound only TT, other wound TT plus TIG. And if someone has forgotten history, only full course in clean wound and full course plus TIG if forgotten history in a other category wound. Okay, so it's not difficult, you can easily understand it. Mainly remember this two things: less than 5 year nothing, 5 to 10 year only TT. So now what is the answer of this question? What is the answer of this question? Let me see. C is the answer you have given, single dose of TT. All of you who have given C answer, you all are C. Correct, very good. You all are correct, very good. Son, Dr. Musaddiq, Dr. Sahgufta. It is single dose of TT because it is 12 year. 12 year is more than 10 year. And in more than 10 year, which category is coming? Clean in less than 6. So we will give only TT one thing. We will not include immunoglobulin here. But if it is 12 year and dirty, then with TT we will also give tetanus immunoglobulin. Okay? Sure. I hope this is clear. Next is, which is not a work of ASA? Can you answer it? Giving vaccine to children and pregnant is not a work of ASA. Accompanying the pregnant, this is a work of ASA. Generate demand of health, this is a work of ASA. Give the medicine of TB and leprosy, this is the work of ASA. 4 things are not ASA and Anganwadi work. What are the 4 things which are not ASA Anganwadi work? Very quickly. First is, they don't measure birth weight, because birth weight is measured by nurse or ANM which is in the hospital. Second is, no vaccination is given by them, but they are paid for every vaccine, and they are not paid for only 3 vaccine. Which 3 vaccine they are not paid? BCG, OPV, Hep B. Why they are not paid for these 3 vaccine? Because these 3 vaccine are given at birth, and ASA is getting payment for working as motivator. And at the birth, mother and mother-in-law are in the hospital. So whom the ASA will motivate? Father-in-law. There is no one to motivate. So they are not getting money for these 3 vaccines. Third thing which they don't do is, they don't make malaria slide. We already have discussed who make malaria slide, MPW, how he make it, by active surveillance. And fourth thing, they don't conduct delivery. They help mother during delivery, but don't help nurses and don't conduct delivery. So these 4 work they don't do. Easily you can answer what are the remaining work they can do, but not this 4 work. What is, where, in which study bias is more? See, bias means systematic error. Systematic error means one-sided mistake, one-sided error. So if you are one-sided, doing making all the decision by one-sided mind, and like you can say, there are some people whom we call andhbhakt. They are blind supporter of BJP. They don't see anything wrong in whatever BJP do. They say everything is good. So if you are thinking everything is good, it means you are thinking one-sided. You are biased. And if you are thinking everything done by BJP is wrong, then also you have some bias, because there must be something which is done. Maybe even 1% good, but some good. So do remember, bias is one-sided thing. And we are maximum biased when we just see the history. Like, again, I can take a political example here. Maximum bias is when we talk about history. Ki Nehru has done this thing, Gandhi has done thing. No one was alive when Nehru and Gandhi or Vallabhbhai Patel was taking the decision. But we just tell whatever we think, ki they were right or they were wrong, without knowing about their reality. So when we go in past, we do case control study. And about past, we can do maximum mistake because we were not present at that moment. And so whenever you ask someone past history, then we get case control study data, and this is full of bias. We never trust it. What is the most common problem in case control study? We call it recall bias. Recall bias means one group who are mostly case. Case means the people who are having the disease. They remember their past. जिसके साथ कांड हुआ होता है उसको कहते हैं केस. कहते हैं ना दोस्त को, अबे तू तो केस है बे, मतलब तू कांडी आदमी है, तू एबनॉर्मल है. So whoever is abnormal disease, that is a case, and whoever is without disease, that is control. So disease and non-disease people are being asked about their past history. One group, they will, disease people, जो लोग कांडी होंगे उनको याद होगा कि क्या हुआ था, लेकिन जो कांडी नहीं है, जो बीमार नहीं है, उनको भूल जाएंगे कि क्या हुआ था. इसको कहते हैं रिकॉल बायस. इन रिकॉल बायस, डिजीज रिमेंबर पास्ट हिस्ट्री, कंट्रोल फॉरगेट, लीडिंग टू रॉन्ग रिजल्ट. सो it is full of bias. Best study to know definitive cause of disease. Definitive cause means we want to be sure that this is causing the disease. So to know the definitive cause, what we have to do? Definitive cause of disease means we want to know natural history of disease. जैसे मान लो आपके बैच में कोई एक बंदा बंदी है जो हर हफ्ते या हर महीने बाइक ठोकता है, गाड़ी ठोकता है. आप जानना चाहते हो कि क्यों गाड़ी ठोक रहा है, व्हाट इज द डेफिनेटिव रीजन. तो वो आपको कोई भी झूठ बोल देगा कि भाई लोगों को चलना नहीं आता. जैसे मेरी बहनी अपनी नई नई स्कूटी हर हफ्ते ठोक के आती थी, बोलती आज भैया एक उड़ाया, आज दो उड़ाया. पूछता था तो बोलती थी कि मैं क्या करूं भैया, खुद ही लोग आ जाते हैं रोड पर, है ना. सो when you will take history from a person who is doing accident, he can give you the wrong reason of accident. This is done in case control. You can get wrong past history. So what is the best way if you want to know why someone is doing research, doing accident? Follow that person. If I want to know why my younger sister is doing accident, I can follow her with another bike or scooty and I will know the real reason. And in which study we do follow up? Follow up is done in cohort study. That's why cohort is known as follow up study. So because in cohort we do follow up, we can know the real reason, definitive reason. So they keep asking this question, what is the best study? Best study to know definitive cause. Sometime in place of definitive cause, they will write what is the best study to know natural history. And as soon as students see history, they tick the word case control. But no, it is not that history. Natural history means what is naturally happening. And what is temporal association? Temporal association means cause precede effect. परिणाम से पहले कारण. Before outcome, before effect, there will be an exposure. All these four things are same thing, and this is best detected by cohort study. Let me explain it with this example of my younger sister. She was doing one accident almost every week, almost every day actually, when she got her new scooty. So ideally I can follow up and see why she is doing accident, but we don't have any other scooty in our home. So what I did, I sit behind her, and then we started from our house. There was a small bridge over a drainage area. Scooty was going through it. A cycle man was coming from there. I said, Mona, brake lagao. Mona, put the brake. She said, laga rahi hu bhaiya, I am putting it. I said, Mona, we are very close, put the brake. She is like, boom, and she hit the cycle man. Then I realized her real reason of accident is her hand was small when she was in 12th class, and she was unable to catch the brake properly, and brake was loose. So how I know the real reason? When I did follow up by risking my own life by sitting there. And then I tightened the brake, and then no problem happened. And I asked her also, ki, you do so many accidents, does no one come and hit you? Mona said, no, bhaiya, don't worry. Whenever I hit some boy, people come, lift my scooty, and they hit the boy only. Ki, by seeing girl, you must have jumped in front of the scooty. So need not to worry about me. I said, okay, keep hitting people. So do remember, all these four things are best by cohort study. One more question they ask, that there was a scientist whose name was Hill. Hill gave some criteria of association. So they can ask, what is the strongest Hill criteria of association? The strongest Hill criteria of association is temporal association. And which one is not a criteria, they ask. Which one is not a Hill criteria? So not a criteria is specificity. Not a criteria is sensitivity. Sensitivity is not a criteria. Specificity is a criteria. For example, in the coal tar, this question has been also asked, that in aniline dye factory industry worker, which type of cancer occur? Bladder cancer occur. So if bladder cancer is specifically occurring in aniline dye industry worker, it means specific means there is some association. But if it is sensitive, then there is no association. Specific means association, Sensitivity do not means association. Like for example, if a boy is talking with every girl, it means there is nothing special because he is a sensitive boy. He include everyone in his talking range. But if a boy for all the 6 years of MBBS, he only talked with one girl, he is specific, then there is something serious. So specificity, only one girl, association. Sensitivity, no association. Okay, and strongest Hill criteria, temporal association. Chalo, next question is the time between infection and maximum infectivity. NEET last year question. Time between entry of infection, when the body had infection, and infectivity. What is this known as? Can you answer it? Entry and maximum infectivity is generation time. But if they ask the question that approximately time gap between first symptom and maximum infectivity. If they ask entry and maximum infectivity is generation time. But if they ask first symptom and maximum infectivity, the time gap between first symptom and maximum infectivity is approximately or roughly equal to. So this time between first symptom and maximum infectivity, this is equal to incubation period. In my last summary class today only I have taken it from 5 to 8. I have discussed this topic also. But if you want, I can summarize it very quickly. Suppose let's say Nikhil sneezed on me. So entry occurred from Nikhil, and in 2-day time, I can develop the first symptom of cough and cold. I can starting coughing. So this gap is between entry and first symptom. This gap is known as incubation period, which is 2 days. Now, what I am asking is the gap between first symptom and maximum infectivity. So, निखिल आया, मुझ पे छींका, मैं 2 दिन में छींकने लगा, इंक्यूबेशन पीरियड 2 दिन है. अब अगले 2 दिन होते होते मैं इतना ज्यादा इन्फेक्शियस हो जाऊंगा कि एक छींक में 10 लोगों को इन्फेक्ट कर दूंगा. तो एंट्री और मैक्सिमम इन्फेक्टिविटी के इसी गैप को हम लोग क्या कहते हैं? इसी गैप को एंट्री से लेके मैक्सिमम इन्फेक्टिविटी को कहते हैं जनरेशन टाइम. और जनरेशन टाइम रफली मान लेते हैं 4 दिन है. 4 दिन में मैं मैक्सिमम इन्फेक्टिव हो गया. तो एंट्री मैक्सिमम इन्फेक्टिविटी जनरेशन टाइम है. एंट्री और फर्स्ट सिम्टम के बीच में 2 दिन लगा है. तो यानी फर्स्ट सिम्टम और मैक्सिमम इन्फेक्टिविटी के बीच में भी रफली 2 दिन लगा होगा. और 2 दिन किसके बराबर है? 2 दिन बराबर है इंक्यूबेशन पीरियड के. इसीलिए मेरा यह सवाल था कि फर्स्ट सिम्टम और मैक्सिमम इन्फेक्टिविटी के बीच का जो गैप है वो किसके बराबर होता है? वो इंक्यूबेशन पीरियड के बराबर होता है. What I was saying in Hindi was that if Nikhil sneezed on me, I will develop first symptom in 2 days. This is incubation period. And in next 2 days, let's say by 4 days, I can infect 10 people with my one sneeze. I become maximum infectivity. So the gap between entry and maximum infectivity is generation time. And if somebody asks what is this gap between first symptom and maximum infectivity, which is 2 days, this 2 days is roughly equal to which duration? So you can see 2 days is roughly equal to incubation period. So this gap between first symptom and maximum infectivity is known as is roughly equal to incubation period. And entry and maximum infectivity is generation time. This was NEET last year question. I am expecting it in this MCI exam only, this question. Time gap between first symptom and maximum infectivity. One of the most expected thing which I am expecting. Now, if prevalence of disease decreases, what is true? PPV increase, decrease, do reply with a response. So do remember this PPV. What is PPV? PPV is positive predictive value. I hope you all know. And what is the formula of positive predictive value? In the formula of positive predictive value, everything is positive. So positive predictive value is true positive by true positive plus false positive. Everything is positive. And this positive predictive value is directly proportional to prevalence. Prevalence means total people who have disease. and there is a formula of prevalence also. Prevalence is incidence into duration. Okay, but सीधी सी बात है, अगर कोई ऐसी पॉपुलेशन है जिसमें ज्यादा लोग बीमार हैं तो उसमें पीपीवी ज्यादा होगा. जैसे सेक्स वर्कर में सर्वाइकल कैंसर ज्यादा है तो सेक्स वर्कर में पैप स्मीयर करेंगे तो उसका पीपीवी ज्यादा आएगा, और नॉर्मल फीमेल में पीपीवी कम आएगा क्योंकि नॉर्मल फीमेल में प्रिवलेंस ऑफ सर्वाइकल कैंसर कम है. तो यहां पर इस क्वेश्चन में भी पीपीवी कम हो रहा है, प्रिवलेंस कम हो रहा है. तो प्रिवलेंस कम होने से क्या कम होगा? पीपीवी कम होगा. What I was saying in Hindi was that if you do pap smear in sex worker, because in sex worker cervical cancer prevalence is more, so positive predictive value of pap smear will come more. And if you apply pap smear in normal female, because prevalence of cervical cancer is less in normal female, PPV will also be less. So PPV is directly proportional to prevalence. That's why in this question, because prevalence is decreasing, so PPV will also decrease. Okay. Next question is that in a 5-year duration term, what 5-year duration we used for which thing in leprosy treatment? Do we use it for treatment of paucibacillary leprosy? Paucibacillary, I hope you all know, less than equal to 5 patch. What is the time for which we treat paucibacillary? We treat for 6 months. And what is the time for which we treat multibacillary? We treat for 1 year. Multibacillary is treated for 1 year. Now, after treatment surveillance, which is known as follow-up. Follow-up in paucibacillary leprosy is only 2 years. And follow-up of multibacillary leprosy is 5 years. So 5 year which thing? 5 year is follow-up of multibacillary leprosy case. Okay? And there is a drug, clofazimine, which I hope you all know. This drug is responsible for 2 side effects. One which has been asked, darkening of skin is due to clofazimine. काला पड़ जाएगा बंदा इस दवाई के असर में. Second is opacification of lens. Lens will have cataract-like changes. So these 2 problems occur. Second thing they ask, what is the drug of choice for lepra reaction? So if you develop lepra reaction, drug of choice is not clofazimine or dapsone. This is methylprednisolone. And when you give methylprednisolone, you don't stop the treatment. You have to continue the multiple drug therapy for leprosy. You will continue, because if you will stop the drug, then under a steroid effect, bacteria will multiply very quickly and disease will flare up. Leprosy will become very quick. In the demographic cycle, if I talk about early expanding, out of ABCD, what is the stage which is early expanding? I want this answer from you. I will not reply this time without getting your answer, because this area we think we know, but it is very confusing. So please reply. Please tell me. Very good. Himalayan was correct in answering it. And you are replying it in very good speed. So I hope this time also you will reply. This was one of the question in MCI also exam, that which 2 stage have high birth rate? High birth rate are in which 2 stage? So high birth rate is in first stage and second stage. First stage is known as, I hope you all know, first stage is known as high stationary. High stationary, India used to be in this phase before 1950. Birth rate was high in India, death rate was high. You must have heard it from our grandparents, 7 children, 8 children, 4 died, 3 lived, like that. So this was before 1950, high birth, high death. So population was stationary. Second phase is early expanding. India was in early expanding between 1950 till you can say 2000. In early expanding, birth rate was still high. So birth rate was high and death rate started decreasing. So in early expanding, what are the 2 things which is happening? Birth rate remain high, death rate start decreasing. This is option D, which is early expanding. So birth rate are high in which 2 phase? High stationary and early expanding, both have high birth rate. So you will remember early expanding with this, that birth rate high, early expanding. which is late expanding. Late expanding means birth rate, death rate both decreasing. This is late expanding. And they can ask this question, India is in which phase right now? So India is in this phase of late expanding when our birth rate, death rate both are decreasing. And okay, so this is late expanding. This first phase, high birth, high death, is high stationary, है ना? So first phase, do I need to revise this demographic cycle? I hope no. This is one topic which you cannot forget to revise. High stationary means birth rate, death rate both are high. Early expanding, birth rate high, death rate start decreasing. Late expanding, birth rate, death rate both decreases. And after that come low stationary. Low stationary means birth rate and death rate both low. If you are not understanding this topic, please, in my YouTube channel by Ashwani Ranjan PSM, you can see a separate video on demographic cycle and demographic indicator. And in the very just 10-minute video, in very first 2-3 minutes, in Hindi this video is there. You can completely understand this concept of demographic cycle. And I hope it is clear to you. If not, feel free to write it in the YouTube chat and I will explain this thing to you. Because 2 questions in NEET exam came from demographic cycle. So it is important to remember. So when it comes to both birth rate, death rate low, this is low stationary. And what is the last stage declining? Declining means death rate is more than birth rate. Like for last 2 years in China, death is more than birth. So that is declining. Okay. So these are the 5 stages. Remember, in first and 2, early expanding, early expanding, birth rate is still high. Okay. Second thing, they can ask the question by giving a small numerical in this exam also on growth rate. Remember, growth rate is birth rate minus death rate by 10. Because birth rate, death rate are in 1000 and growth rate is in 100. So to remove the extra 0, we divide by 10. Okay. Next question is, a study that give prevalence of depression in adolescent in a school at a given point of time is known as, do you know it as a case control study? Do you know it as a cohort, cross-sectional, ecological study? Which study is this study? Please do reply. And this is a common question they ask, that which study tell us about cross product ratio? As soon as people see this question, cross product ratio is detected by which study? As soon as they see cross product ratio, they reply cross product cross sectional. No, cross product ratio is the other name of odds ratio. And odds ratio formula is AD by BC. If this is the table, A is here, D is here, B is here, C is here. So when we write AD by BC, A is with D, B with C. So we are doing cross multiplication. That's why odds ratio is known as cross product ratio. AD by BC is the formula. And we detect it in case control study. Now, one of the very famous name of cohort study is incidence study. Incidence means new case by population at risk. जितने लोगों को इन्फेक्शन या बीमारी हो सकता है, उसमें से कितनों को इन्फेक्शन हुआ, इसको कहते हैं इंसिडेंस. And incidence means new case. So when you will have new boyfriend, new girlfriend in future or in past? Of course, new boyfriend, new girlfriend will be in future. And in future, we have cohort study, follow-up study, prospective study. So that's why incidence is found in cohort study, because in cohort, we do follow-up. We do future study, new case detection. है ना, आपको भी नई बंदी फ्यूचर में मिलेगी, तो नई बंदी इंसिडेंस, नया केस, कोहॉर्ट स्टडी, फ्यूचर स्टडी. देन व्हेन वी वांट टू नो प्रिवलेंस we detect in cross sectional. Suppose I ask it from your class, how many of you have cold and cough right now? And you said that 10 people out of 1000 have cold and cough. So if 10 people out of 1000 have cold and cough, 10 is the prevalence. 10 people have this. Now this 10 people can be new case of cold and cough or can be old case. So new plus old case is prevalence. And prevalence we detect in cross sectional. That is why cross sectional is known as a snapshot study. Tell me, can you take picture in future or past? Of course not. You can take picture only in present moment. And cross-sectional study tell only about present moment. In past, we have case control. In future, we have cohort. Present moment cross-sectional. So that's why cross-sectional is snapshot or prevalence study. Do remember these names. They keep asking it. What is the other name of ecological study? Ecological study is known as correlational study. Because in ecological study, we correlate the data of hospital with population. Like a very common example being already asked it, if you want to know that does cigarette sell is causing more COPD. So COPD is hospital data, cigarette sell is taxation department data. You are collecting population data of taxation department, and cigarette and COPD is hospital data. So whenever we correlate hospital and population data, that is correlational ecological study. And we do ecological study on population. So remember this. This is a common question they ask. Which study is done on whole population? So on whole population, we do ecological study. And rest all study we do on individual. Okay, so do remember these questions. Very important area. Next is prevalence of diabetes in adult of India is roughly 7 to 8.5. And if you look at double of this, double of 8, 16. So if you look prevalence of hypertension, hypertension is 16 to 24% of Indian. Diabetes is in 7 to 8%. And if they ask what is the old age people percentage in India, old age means more than 60. In India, the cutoff is 65 year. So more than 65 year is also 8%. So old age and diabetic is same. And for old age, we have Rashtriya Vayosri Yojana, in which we give some assisted living devices like caliper wheelchair to BPL senior citizen. One very important point which they can ask in this exam is, what is the new thing which they have done in Ayushman Bharat? So in Ayushman Bharat, I hope you all have seen the logo with a pot and 5 green leaf telling about 5 lakh insurance. So this 5 lakh insurance which is given per year for every family who belong to economically weaker section. This program is known as PMJ, Pradhan Mantri Jan Arogya Yojana. They can ask the full form also of PMJ. So in PMJ, previously there was only economically weaker section family who are earning less than 10,000. But now along with EWS, the new thing which government has done, they have said that all the people who are not getting any pension and who are old age, non-pensioner, they will also get 5 lakh health insurance under which program? PMJ. And PMJ come under which thing? Ayushman Bharat. So this Ayushman Bharat, they have asked, is it funded by center or state or both? So Ayushman Bharat, we all think it is only BJP Modi. No, Ayushman Bharat has both state and center funding. State give 30 to 40% and center give 60 to 70% funding. So it has both center and state funding. There are two more programs which has both state and center funding. One is the Factory ESI Act, and second is the Food Safety Standard Authority of India. This also come under both state and center list. When they talk about ESI Act, in ESI, 1/8 of money come from state government and 7/8 of money come from central government. So who is the main funder of ESI? Again, central government. Like who is the main funder of Ayushman Bharat? Central government. So this is first thing in Ayushman Bharat, PMJ. Second thing in Ayushman Bharat is known as Health and Wellness Center. What they do in Health and Wellness Center? Around 1.5 lakh sub-center and some PHC, their name will be changed to Health and Wellness Center, and they will give 8 new facility there. First is dental, second is mental psychiatry health, third is ENT, then opthal, ENT opthal together, then old age, geriatric and newborn and child, old as new. So old new together, dental mental together, ENT opthal together. 6 is done. Last 2 is palliative care for post cancer pain relief and yoga and meditation, क्योंकि yoga से सब होगा. So these are 8 facility given in Health and Wellness Center. And then the third thing which is in school Ayushman Bharat is school health program, which asked in MCI exam also already. this school health program, it come under PHC Vision Center also, and it also come under Ayushman Bharat. Why it is under PHC Vision Center? Because at the PHC, teacher get 1 day training and teacher does screening. Screen for which thing? Teacher asks 150 student of class 4 to 8 to stand in a line, close one line, on a pillar they hang a Snellen chart, close one eye read, then close another eye read, like that. So teacher is screening. One teacher get 1 day training at PHC and then screen for refractive error, screen for low visual acuity. So because training is at PHC, so school health program come under PHC. And second thing in school health program is health and wellness day. This health and wellness day government is planning to celebrate on every Tuesday. On that Tuesday, they will train the student for yoga and meditation. So because health and wellness day are in school health and health and wellness center are the name of sub center PHC. So that's why school health also come under Ayushman Bharat. So do remember Ayushman Bharat have three things: PMJ, health and wellness center, and school health program. And school health also come under PHC Vision Center. Okay, chalo. Next question is, what is the best indicator for spread of TB in a community? So when they talk about spread of TB, they are basically talking about spread of TB infection. एक इंसान से दूसरे इंसान तक टीबी की बीमारी नहीं फैलती है, इन्फेक्शन फैलता है. जैसे मेरे ऊपर कोई टीबी का मरीज आके खांसेगा तो मैं बीमार नहीं हो जाऊंगा, मेरे को इन्फेक्शन होगा. इन्फेक्शन भारत में करीब 40% भारतीयों को है. और जब इन्फेक्शन वाला मरीज किसी रीजन से इम्यूनिटी कम कर लेता है, जैसे वो खाना नाश्ता छोड़ दे, माल नरिष्ट हो जाए, या फिर इसकी इम्यूनिटी लो हो जाए, तब जाकर के ये इन्फेक्शन बीमारी में कन्वर्ट होता है. तो मुझ पे कोई खांसे फर्क नहीं पड़ेगा क्योंकि मेरी इम्यूनिटी ठीक है. लो इम्यूनिटी होने पर या माल नरिष्ट होने पर इन्फेक्शन बीमारी में कन्वर्ट होता है. What I was saying is, infection is in 40% Indian, and if a patient sneezed on me or coughed on me with TB infection, still I will not be developing TB because I have good immunity and I am not malnourished. Unless immunity is low or malnourished, only then disease will occur. And for the detection of infection, we do two tests. One is tuberculin test. Tuberculin is Montauk's test. Second test we do is interferon gamma release assay. So IGRA is something from which this question has came in NEET exam, that in which test we take whole blood sample of patient. Whole blood sample is taken in IGRA and it is very costly. So we cannot do it in whole population. So in whole population, if you want to know about spread of TB infection, we do annual infection rate. What is the other name of annual infection rate? Annual infection rate is also known as annual tuberculin conversion index. What we do, we suppose take 100 children. In 100 children, suppose 40% have tuberculin positive reaction. Next year also we will test on the same 100 children. Suppose this time tuberculin infection is in 60 children. So that means annual risk of tuberculin conversion is 20%. From 40 last year, it became 60. So this way we can know how rapidly TB infection is going in a village or in a population. So this is known as annual infection rate. So tuberculin test is best to know spread of TB infection. If they ask best to know spread of TB infection, then answer is tuberculin. But if they ask that what is the best test to know spread of TB disease, if you want to know spread of TB disease in a village, then here disease is talking about. And when they talk about disease, first method of detecting disease is ZN smear. So if you want to know in a village, then ZN smear is best. But if they ask the better test, CBNAT is definitely better. And if they ask the best test, gold standard for TB disease diagnosis, then the gold standard is culture in liquid medium. Solid medium is Lowenstein-Jensen medium, but liquid medium, which is Mycobacterium growth inducer tube medium, this is the medium which is gold standard, best. gold standard is culture. Why not CB-NAT? Because CB-NAT overdiagnose, है ना? Atypical mycobacteria also come positive in CB-NAT. But in culture, we can see the characteristic of colony growth, so we can never overdiagnose. Plus, there is one more method to diagnose disease, that is fluorescent microscopy. And in fluorescent microscopy, we can use two dye, auramine O or rhodamine O. These two dye will make the bacteria glow. And even if there is one bacteria on the slide, we can see, oh, there is bacteria. So less chance of missing. So these are the four methods of disease, and best for screening of TB disease is ZN smear. Best for confirming TB disease is gold culture in liquid medium. But do remember one more thing. They ask which is not done for TB. Not done for TB disease or anything is serological test. Previously, they used to do serological test. Serological test will detect antibody of TB. An antibody can also be prepared due to BCG vaccination history. है ना? So this is why serological test of TB is something which is not done for TB anymore. Gone. Old test. Okay? Chalo. Next question. Which do not have live birth as denominator? So if you look at the formula of infant mortality rate, it simply write live birth here and all the death which is occurring up to 1 year age as the numerator and multiplied by 1000. So this is IMR. When then write neonatal mortality, neonatal mortality is also is live birth plus numerator is death in first 28 day and it is also multiplied by 1000. So this also have live birth. When they talk under 5 mortality, under 5 mortality is also live birth plus in the numerator they write death in 5 year and they also multiply it with 1000. So in all these three, infant, under 5, neonatal, the denominator is live birth. And for all these three, if they ask what is the most common reason is premature delivery. Premature delivery we call when someone deliver before 37-week period of gestation. So if someone will deliver before 37 weeks, that will lead to low birth weight, and that is premature delivery or low birth weight is the first most common reason. Second common reason, they have asked in one of the exam to arrange the reason. So we should know what is the sequence of reasons. Second reason is asphyxia death, like meconium aspiration and all. Asphyxia. Third reason is pneumonia. Fourth reason is sepsis. Fifth reason is diarrhea. And sixth reason is other cause, accident and other thing, other and accident. Then last, seventh reason is congenital anomaly. So if someone asks what is the most common cause of infant death in India? Premature delivery. What is the least common cause of infant death in India? Congenital anomaly. But in US, UK, most common reason of infant death is congenital anomaly because US, UK has taken care of other 6 reasons. So all these 3 have the same answer. But child death rate, this do not have live birth as denominator. This was 2-time question in INI-CET exam in last 5 years only. So do remember this thing. What is child death rate? Child death rate simply means what are the death which are between 1 to 4 years divided by how many children are between 1 to 4 years. So it is children between 1 to 4 years and numerator is death between 1 to 4 years, and then we can multiply by 1000. 1 to 4 years we write, it means just before becoming 5 years. So it is roughly 1 to 5 years you can say. टोटल कितने बच्चे थे 1 से 5 साल में, उसमें से कितने टपक गए, मर गए. ये है चाइल्ड डेथ रेट. तो चाइल्ड डेथ रेट में खासियत क्या है कि ये पहले 1 साल की बात नहीं करता है, क्योंकि मोस्टली पहले 1 साल में लोग प्रीमैच्योर डिलीवरी और एस्फिक्सिया से मर जाते हैं. ये 1 साल के बाद बच्चे क्यों मर रहे हैं उस पर ध्यान देता है. और इसीलिए चाइल्ड डेथ रेट का अगर पूछा जाए कि सबसे कॉमन कारण क्या है, तो इसमें आंसर हो जाएगा, थर्ड रीजन से शुरू करेंगे, निमोनिया मोस्ट कॉमन होगा। निमोनिया के बाद इसमें सेकंड रीजन अब हो जाएगा डायरिया, फिर हो जाएगा सेप्सिस। ये है चाइल्ड डेथ रेट के पहले, दूसरे और तीसरे कारण, निमोनिया, डायरिया, सेप्सिस। तो चाइल्ड डेथ रेट बिल्कुल अलग बात, इंफॉर्मेशन बताता है कि 1 साल के बाद बच्चे क्यों मर रहे हैं, इसलिए ये बार बार पूछते हैं, और इसमें सीक्वेंस ऑफ डिजीज भी पूछ सकते हैं। What I was saying in Hindi was, in child death rate, we are comparing death between 1 to 5 year and how many children are between 1 to 5 year. So it is not counting those deaths which is occurring in less than 1 year. And in less than 1 year, mostly we die due to premature delivery or asphyxia. So it is talking about those deaths which occur after 1 year, and there the first common reason is pneumonia, then diarrhea, then sepsis. Okay, so there is a lot of question which covered here. Do remember this formula and this sequence also. Next question is that in a cohort of nurses with control group is a study for use of intrauterine devices like copper T and all, and abdominal pain as side effect in a case control manner. This type of study is prospective, non-concurrent cohort, concurrent cohort, mixed cohort. What is happening here? They have taken 2 group of nurses. One group IUCD given in nurses, second group in which IUCD is not given. After giving IUCD and not giving IUCD, we start doing follow up, and we did not started any study. There is no follow up right now done. We simply, let's say we waited for a period of 1 year or 2 years. In this 1 year, this 2 group of nurses, IUCD and non IUCD, they keep reporting the side effects. Some came with abdominal pain, some came with bleeding. They keep reporting the side effect, which we were just writing in hospital diary. We are not doing any study now. Now, after 1 year, after this 1 year time passed, here, now we started doing study. So, after this 1 year has passed, now we start study. And when we start this study, what we are doing here, we are having this 2 group IUCD and non-IUCD. We are taking the past written data, past reporting we are taking. And along with past reporting, we are also doing follow up in future. So what are the 2 things done here? Follow up in future plus past written data, we are taking both. हम आगे भी जा रहे हैं और पीछे जो पहले 1 साल पहले डेटा कलेक्ट किया था वो भी लिख रहे हैं. We are going ahead by 1-2 year follow-up study, and we are also using the data of past written already in last 1 year. So that's why they have used the word, we are detecting them in a case control manner. Case control means we are taking past data also, and plus we are also doing the follow-up. We are trying to know the side effects in future, and we are using the past data also. So when you go both future and past, this study is known as mixed cohort study, because it is future also, past also. This is mixed cohort. This is one topic which already came in NEET INI-CET and expecting it in this June FMGE exam. Let me give you a very simple example. Suppose you did very hard work and took radiology branch, and now you are giving a big party after taking radiology branch. Now your neighbor Majnu Bhai came in that party and said, don't you know, my dear friend, that based on last 10-year work record data, based on the data of last 10-year work record, radiology staff have 1.2 times more risk of testicular cancer as compared to other staff. तो क्या बोल रहा है मजनू भाई कि बेटा तेरे टट्टे खतरे में हैं और तू पार्टी दे रहा है. दूसरे स्टाफ के मुकाबले रेडियोलॉजी स्टाफ में कैंसर, टट्टों के कैंसर का चांस 1.2 टाइम ज्यादा है. So what he is saying here is, he is taking last 10-year work record data, and based on this last 10-year work record data, he is saying radiology staff has more risk as compared to other staff. So basically 1.2 time is not a more risk. If in radiology department 6 people is having cancer and in other department 5 people are having cancer out of 10,000 people, then 6 by 5 is also 1.2. And one more case can be over detection also. In radiology department, we can easily get our PET scan, CT scan done. So we can over diagnose also. So it's not a big association. But in this story, the data is based on last 10-year work record only. This type of study is known as historical cohort और retrospective cohort. जिस भी कोहॉर्ट में हम सिर्फ पीछे का लिखा हुआ डेटा यूज करते हैं उसको रिट्रोस्पेक्टिव या हिस्टोरिकल कोहॉर्ट कहते हैं. इसमें हम हाउ विल यू डिफरेंशिएट रिट्रोस्पेक्टिव और हिस्टोरिकल कोहॉर्ट फ्रॉम केस कंट्रोल स्टडी? In case control, we take personal history. Here we are not taking personal history. We are using written work record data, written data. So if you are taking only written data, this is retrospective historical cohort. Now suppose you said कि जलता है मजनू. Majnu is just jealous. He is just telling wrong thing. And you took radiology department in spite of Majnu warning. After taking radiology, you start doing 3-year follow-up study, and you did it for 3-year follow-up study, and along with 3-year follow-up study, you also used last 10-year work record data. So now what you are doing? You are doing two things. You are doing follow-up. Follow-up means future, and also using past work record data. So this time, because you are going future and past both, this type of study is known as mixed cohort. क्योंकि ये केस कंट्रोल भी है, cohort भी है, past भी future भी, because it is both past future, so it is mixed cohort. Other name of mixed cohort is ambispective. Why we call it ambispective? क्योंकि ये दोनों तरफ जा सकता है, आगे भी जा सकता है, पीछे भी. It is ambispective cohort because it can go in both direction, forward and backward. And the other last name is nested case control. What is this nested case control? देखो, एक बात सोच के बताओ, कौन सी स्टडी करना ज्यादा मुश्किल है? 3 साल का फॉलो अप करना या 10 साल का डेटा पीछे का लेना? जाहिर सी बात है, पीछे का डेटा तो कंप्यूटर में ऑलरेडी है, एक क्लिक में आ जाएगा. तो पीछे का डेटा लेना बहुत आसान है ना? इसीलिए कहा जाता है कि जो हम केस कंट्रोल करते हैं वो रेयर डिजीज के लिए करना आसान है. इजी टू डू फॉर रेयर डिजीज, क्योंकि बस एक क्लिक देंगे और हमें पास्ट का डेटा निकल के आ जाएगा. बट फॉलोअप में 3 साल तक उनको देखना पड़ेगा, कई लोग छोड़ेंगे, ध्यान देना पड़ेगा. तो असली दम लगेगा फॉलो अप में. और उस फॉलो अप यानी कोहॉर्ट स्टडी में हम पीछे के 10 साल के डेटा को घुसा रहे हैं. तो केस कंट्रोल ने घोंसला बना लिया है. क्या बना लिया है? घोंसला. किसमें? कोहॉर्ट में. इसलिए इसको कहते हैं नेस्टेड केस कंट्रोल. किसने घोंसला बनाया? पीछे की स्टडी ने, केस कंट्रोल ने. है ये कोहॉर्ट, लेकिन घोंसला किसने बनाया? केस कंट्रोल ने. और क्योंकि इसमें आगे पीछे दोनों जा रहे हैं, इसलिए इसको मिक्स्ड एम्बिस्पेक्टिव कहेंगे. What I was saying in Hindi was that out of this 3-year follow-up and 10-year work record data, follow-up is the main hard work, because 10-year work record data is already in the computer. It can come by a click of computer. That is why case control is easy to do for rare disease, because we can quickly do it. But main study is cohort, in which we are inserting the data of past. So we are nesting case control inside cohort. That's why it is nested case control. And because it is both forward backward direction, so it is mixed or ambispective cohort. So this two type of example they can create, and they can ask the question in exam. Do remember, if in the question only past work record, then it is retrospective historical, and past work record plus future follow up, then it is mixed ambispective nested. To remember this, you can use the mnemonic RH positive man. Erythroblastosis fetalis occur only if man is RS positive. So RH stand for retrospective and historical. Man stand for mixed, ambispertive, nested. You know man can go anyway. So man is in both direction, RH only in past direction. Okay. There was a similar question in one of the INI-CET exam, that you took 10,000 mother, took their habit history कि क्या तुम सुट्टा पीती हो, क्या तुम दारू पीती हो, तुम गांजा क्यों नहीं फूकती हो, all smoking history you took. After that you followed them for 6 months and then you use past data of questionnaire plus follow-up data. Which type of study is there? So because it is past data of questionnaire plus 6-month follow-up data, past follow-up, both means mixed cohort, both means ambispertive, both means nested case control. So that was an example of ambispertive cohort when you are following up the mother and also using past data. Next question. When we talk about Vision 2020, it include trachoma, it include diabetic retinopathy, but diabetic retinopathy is in India list and it is not in WHO list. And here they are asking about WHO. It should be written in full form, but it is asking WHO Vision 2020. So WHO Vision 2020 include 5 diseases. What are those 5 diseases? Cataract, refractive error, and vitamin A deficiency. Okay. 4th disease is trachoma, and 5th disease is onchocercosis. This onchocercosis is transmitted by black fly and it only occur in Africa. So it is not in India list. Onchocercosis is not in India list. And in place of onchocercosis, in India list, there is this first 3 disease, plus there is trachoma, and after this, there is the remaining 3 diseases: diabetic retinopathy, corneal opacity, and glaucoma. So India have 7 diseases in the list. WHO have only 5 diseases. Now there is 3 questions which come from this part. First question: what is the most common cause of low vision? People tick cataract. No. Cataract is most common cause of blindness. Blindness is by cataract. But if somebody ask most common cause of low vision is mostly by refractive error, because refractive error can affect children, young age, at old age, everyone. And if they ask what is the most common cause of blindness in children, so blindness in children is most commonly by vitamin A deficiency, xerophthalmia. So these 3 are different questions. And we already know that trachoma follows safe strategy, where S is not sex, S is surgery, A for antibiotic, 1% azithromycin, F for not fuck off, face wash, facial hygiene, and E for environmental cleanliness. Do remember it. Chalo, next question is that which of the following is correct for antigenic drift? So when we talk about influenza, there is 2 confusing concepts which micro PSM both ask: antigenic shift and drift. We can simply remember it like this, that suppose you are driving a car enjoying good music in 140, 60, 160 you are going. Suddenly you have a big accident, so big that your car toppled upside down and went to the wrong side of the road. This is shift, big thing. And this shift occur in type A influenza and type B influenza. And type A influenza is most common reason why pandemic occur and epidemic occur. So that means shift is something which is sudden change, and it is very big change, sudden and big. And what will happen if you will go from one side to road to another? There will be complete rearrangement of gene or reallocation of gene. So there is complete rearrangement of gene, reallocation of gene, which occur in shift, and it mostly occur in type A. But drift is like you are drifting the car, and like in Tokyo Drift movie and all, and there is suppose there is a girl in the center and you want to impress the girl. So to impress the girl, you are drifting the car around the girl. So drift is also sudden, but due to drifting the car around the girl can naturally select it. The girl can naturally select you, the boy. So drift is something which is also sudden, but it is very small thing. Drifting is a small thing. And what drift lead to? Drift lead to natural selection. And due to this natural selection, it will cause some point mutation, small change will come. So drift is also sudden, but it is small, leading to point mutation, not rearrangement or reassortment of gene. Reassortment is due to shift, and natural selection, point mutation, is drift, small thing. So drift is something which occur in type B and it also occur in type C. But when it occur in type B, drift is small. So this will only lead to seasonal influenza, not big epidemic or big pandemic. Okay. So from here 3 questions come. First question, that what is the most common influenza virus? Most common is type B or type A? Most common is type A, because type A lead to pandemic and epidemic. So most common virus is type A. Do remember. Second thing they ask, natural selection lead to drift or shift? Natural selection lead to drift. And third thing they ask, pandemic occur due to shift or drift? So pandemic is a big thing which will occur due to shift. Okay. So this is the 3-4 question which come. Let's do this true false question. Which is correct for drift? First, it is seen in influenza type A. No, type A has shift, not drift. It is result of frame shift mutation. No, frame shift mutation lead to shift, not drift. And so both type A is in shift mutation, frame shift mutation is in shift, big sudden change. Then it does not occur due to natural selection. This is not correct, because natural selection lead to shift, and here they have written does not occur. So it actually occur due to natural selection. Last is, it is responsible for seasonal epidemic. This is correct. Seasonal epidemic can occur due to drift in type B influenza virus. Seasonal influenza can occur. So I hope whether in micro or PSM, if drift shift came, you will remember this car example and you will be easily able to answer all the questions from drift and shift. But also remember, what is the drug of choice for influenza? The drug of choice is oseltamivir. Okay. Then H1N1 and H7N9, these are the 2 more type of influenza. You should know about them in detail in micro. But focus here in the next question. Suppose you got this information that ANM is coming to subcenter, staying there for 1-2 hours, and then going back, not doing any work. You got this information from some informer. Now you want to know whether ANM actually work or not actually work. तो आपने एक दिन सब सेंटर पे मारा धप्पा. You suddenly went to sub center to check the register that whether they are working or not. So how many pregnancies should be there in the register to know that ANM is working? How many minimum pregnancies should be there? So I hope you remember and you know, subcenter is at 3,000 and 5,000 population, 5,000 in plain area and 3,000 in hilly area. Because in hilly area people are far away, so less population, one subcenter. Plain area people are close, so more. Now, because 85% population of India live in plain, so we will take 5,000 as subcenter population if they have written also plain area. So it is 5,000. Then birth rate is given 20 per 1,000. Sometimes they don't give birth rate, then you have to take 20 per 1,000. So this type of question has to be done in 3 steps. In the first step, you will calculate what is the total live birth at subcenter in a year. सबसेंटर में एक साल में कितने बच्चे पैदा हो जाते हैं ये पता लगाना है. तो देखो 20 बच्चे पैदा हो रहे हैं 1000 पे, लिखा हुआ है ना, 20 बच्चे 1000 पे पैदा हो रहे हैं, यही बर्थ रेट है. और सब सेंटर का पॉपुलेशन है 5000. तो टोटल कितने बच्चे पैदा हुए एक साल में? 1000 और 5000 का 3 3 जीरो कट गया, 20 × 5 आ गया 100. एक साल में 100 बच्चे पैदा हुए. What I was saying in Hindi was that if you want to know how many live birth occur at subcenter in a year, we already know 20 birth occur in 1,000 people, and at subcenter there is 5,000 people. So 20 by 1,000 into 5,000 you will do. It will come 20 into 500. So simple first step is, if you want to know live birth, multiply birth rate by 5. 20 into 5 live birth. But tell me one thing. Do all pregnancy go till live delivery? No. Some pregnancy go through abortion, stillbirth also. So if you want to know pregnancy in a year is all the live birth plus 10% of live birth. What is this 10% of live birth? This 10% of live birth simply means pregnancy wastage factor, because around 10% pregnancy got aborted or stillbirth. So सीधी सी बात है, what I was saying in English was कि सारी प्रेगनेंसी डिलीवरी तक नहीं जाती है, 10% प्रेगनेंसी बेकार हो जाती है. तो अगर कहीं पे बच्चे पैदा हो रहे हैं 100, तो प्रेगनेंसी 100 में 10% एक्स्ट्रा हुई होगी, वो 10% प्रेगनेंसी एबॉर्शन हो गई होगी या स्टिल बर्थ हो गया होगा. तो अगर हमें एक साल में प्रेगनेंसी जाननी है तो लाइव बर्थ तो 100 लिखेंगे ही, प्लस उसमें 100 का 10% लिख देंगे, और 10% 100 का कितना होता है? 10. तो एक साल में कितनी प्रेगनेंसी हुई? 100 प्लस 10 110. What I was saying in Hindi was that total pregnancy is live birth plus 10% of those pregnancy which did not give live birth, which aborted. So 10% of 100 is 10. That's why pregnancy in a year will come 100 plus 10, 110. But second step is pregnancy in a year, which is 100 live birth plus 10%. And this question has came in UPSC also. What is pregnancy wastage factor? 10% of live birth. But here they don't want to know pregnancy in a year. They want to know pregnancy at any time in ANM register. वो पूछ रहे हैं कि कभी भी जब अचानक से आओगे तो कितनी प्रेगनेंसी होगी ANM के रजिस्टर में. तो देखो भाई, एक साल में होते हैं 12 महीने, और प्रेगनेंसी 9 महीने की तो है, लेकिन पहले 3 महीने तक तो रिपोर्टिंग ही नहीं होती है. रिपोर्टिंग का पहला विजिट 12 वीक है, पहले कर सकती है बट यूजुअली 12 वीक पे विजिट होती है. तो यानी प्रेगनेंसी केवल 6 महीने तक रजिस्टर में रहती है, चौथे, पांचवें, छठे, सातवें, आठवें, नौवें. 6 महीना यानी 12 महीने का आधा. तो अगर हमें पता लगाना है कि कभी भी रजिस्टर में कितनी प्रेगनेंसी होगी, तो जो भी 12 महीने में साल भर में प्रेगनेंसी है उसका आधा कर देंगे, तो पता चलेगा कि 6 महीने में कितनी प्रेगनेंसी रजिस्टर्ड में होती है. और रजिस्टर में कभी भी जो प्रेगनेंसी है वो सालाना प्रेगनेंसी की आधी होगी. क्यों आधी होगी? क्योंकि प्रेगनेंसी का रजिस्टर में एंट्री ही 6 महीने के लिए होता है, और साल 12 महीने का है, तो उसका आधा करेंगे तो एट एनी टाइम कितनी प्रेगनेंसी होगी ये पता चल जाएगा. व्हाट आई वाज सेइंग इन हिंदी वाज दैट बिकॉज इन ए रजिस्टर pregnancy remain only for 6 months, because first visit occur at around 12 week and then it remain till 9 month. So in the register the name is written in 4th month, 5th, 6th, 7th, 8th, 9th. Only for 6 months it is written and register, and in a year there are 12 months. So if you divide 12 by 2, then it will come 6 months, which is the time for which pregnancy is in the register. So if they want pregnancy at any time, you will divide yearly by 2 and then you will get pregnancy at any time in register. So what was the yearly pregnancy in our story? 110. And how many will remain at any time? 110 by 2, it will become 55. So 55 pregnancy minimum should be there in ANM register when you visit subcenter. If 55 pregnancy is not there, it means ANM is not working. Okay. Now, based on the same concept, MCI asked one question 3 years back. This was an MCI PYQ also. Question was, if birth rate is 25 per 1,000, then for 5,000 population sub-center, नंबर ऑफ प्रेगनेंसी इन ए ईयर विल बी, एक साल में कितनी प्रेगनेंसी होगी, ये सवाल का जवाब आपको देना है मुझे। क्या आंसर होगा 138 या होगा 125 या होगा 69 या होगा 55? क्या आंसर होगा? तो देखो, फर्स्ट स्टेप इज ऑलवेज you have to find the live birth in a year. Remember, first step, live birth in a year. And what is the live birth in a year? Live birth in a year is simple formula, birth rate multiply by 5, because we are finding live birth in a year at sub center, and sub center is at 5,000 population. So we will simply multiply birth rate with 5, it will come get the answer. Birth rate is, how much is birth rate? 25. So 25 per 1000 into 5,000, 1,000 will cancel, it will come 125. So live birth in a year is 125. Now tell me, what is the answer to this question? How many pregnancy will be registered in a year? Is it 125, 138, 69, 55? What is the answer? Very good, Deepak B. Himalayan. Very good. You are करेक्टली रिप्लाइंग, आंसर इज 138. समझो इस बात को, कैसे 138 आंसर आया? लाइव बर्थ यू फाइंड आउट बाय मल्टीप्लाइंग बर्थ रेट विथ 5. देन दिस इज द फर्स्ट स्टेप. व्हाट वाज द सेकंड स्टेप? प्रेगनेंसी इन ए ईयर. एंड हाउ वी फाइंड प्रेगनेंसी इन ए ईयर? प्रेगनेंसी इन ए ईयर इज लाइव बर्थ प्लस 10% ऑफ लाइव बर्थ. लाइव बर्थ इज 125 and what is 10% of 125? 12.5. So 125 plus 12.5 is 137.5. Now, can you have 0.5 delivery? No. So roughly we can say it at 138. In this question, they ask yearly pregnancy. So we stopped in second step. We did not went till third step. If they would have asked pregnancy at any time in ANC register, in ANM register, at any time in register, then answer will be 69, half of 138. But they have not asked any time, so we will simply just multiply by 5 and then add 10% and answer will be 138. कुछ नहीं करना है, इतना टेंशन मत लो, मैथ्स देख के डरो मत, सिंपल सी बात है. जो भी लाइव बर्थ लिखा होता है उसको 5 से पहले मल्टीप्लाई कर देना. बर्थ रेट को 5 से मल्टीप्लाई करते ही लाइव बर्थ निकल जाएगा. लाइव बर्थ जो भी निकला है उसमें 10% ऐड कर दोगे तो 1 साल की प्रेगनेंसी निकल जाएगी. हम वही कर रहे हैं. 5 से मल्टीप्लाई किया तो 125 आ गया, उसमें 10% जोड़ दिया, 138 ईयरली प्रेगनेंसी है. अगर पूछता कि किसी भी समय रजिस्टर में कितनी है, तब ईयरली प्रेगनेंसी को 2 से डिवाइड करके 69 आंसर करते हैं. लेकिन यहां पूछा ही नहीं है एट एनी टाइम, इसलिए हम सिर्फ 2 से मल्टीप्लाई करके 5 से मल्टीप्लाई करके लाइव बर्थ निकाले और 10% जोड़ के साल की प्रेगनेंसी आ गई 138, वो टिक कर दिए, है ना. आई वाज एक्सप्लेनिंग द सेम थिंग इन हिंदी, that here because they are not asking pregnancy at any time, they are asking pregnancy in a year. So first step, you will multiply birth rate with 5 to get total live birth. Sometime they can also ask total live birth in a year, that is birth rate into 5. Then here they are asked yearly pregnancy, so you will add 10% of live birth and it will come 138. Now next question is, if the food poisoning is within 1 incubation period, we call it common source single exposure. Other name of common source single exposure is point source epidemic. And very good example of point source epidemic is all the food poisoning in hostel. Suppose all the food poisoning cases are, suppose we are talking about Staph aureus food poisoning. Now Staph aureus incubation period is 2 to 6 hours. If all cases are occurring in 6 hours, we will call it point source. समझो बात को. इंक्यूबेशन पीरियड का मतलब कीड़ा घुसा और पहला लक्षण आया, उसके बीच का गैप इंक्यूबेशन पीरियड है. स्टैफ ऑरियस का फूड पॉइजनिंग का इंक्यूबेशन पीरियड 6 घंटा होता है मैक्सिमम. तो अगर सारा केस 6 घंटे के अंदर है, तभी हम इसको कॉमन सोर्स सिंगल एक्सपोजर पॉइंट सोर्स कहेंगे. तो पॉइंट सोर्स होने के लिए एक इंक्यूबेशन पीरियड में केस होने चाहिए. For calling it point source, all cases should be one incubation period. And for calling it common source continuous, the time should be more than one incubation period. And they keep asking question from example of common source continuous exposure. Like 2 time asked question is milkman distributing contaminated milk. देखो मिल्क दूध वाला क्या कर रहा है कि एक कोई गंदे नल का पानी लिया, उसको दूध में मिलाया और फिर गांव वालों को रोज रोज वही दूध पिला रहा है. तो इस स्टोरी में सोर्स है कॉमन, एक ही गंदा नल है जहां से पानी ले रहा है और गांव वालों को बार बार फैलाया ही जा रहा है, यानी कंटिन्यूअस फैल रहा है. तो ये जो फैलाया ही जा रहा है इसमें टाइम बहुत ज्यादा लग गया ना, एक इंक्यूबेशन पीरियड से ज्यादा टाइम लग गया, इसलिए इसको कहेंगे कंटिन्यूअस एक्सपोजर. What I was saying in Hindi was the source from which milkman is taking the water, polluted water, is common, and he is causing diarrhea in villager again and again. Common exposure is very continuous, and the time taken here is obviously more than one incubation period. So it is common source continuous exposure. Second example is typhoid Mary, who was a cook and a chronic carrier of typhoid bacilli. And chronic carrier store it in gallbladder. From gallbladder it go to intestine and then out. And she was a cook, so she used to give full flavored food, yellow sandwich, yellow burger, and then people were dying due to it. So it was like apni to pathsala, masti ki pathsala. She was just killing people by not washing hand. And then the third example is when sex worker like me transmit gonorrhea to our client. So again there is common source, and it is keep infecting people again and again. So transmitting HIV or gonorrhea can be one example. Fourth example can be contaminated batch of polio vaccine. So the whole batch is contaminated. That's why infection is continuous. So whole batch is contaminated. These 4 are continuous exposure. And when they talk about propagated epidemic, remember one time an image based question has also come from here. Propagated means there will be one peak and then after a gap there will be a second big peak. This second big peak is known as secondary wave. Did you remember something from secondary wave? Yes, corona. So whenever they talk about secondary wave, whenever they talk about corona, swine flu, influenza, SARS, MERS, all those infections which transmit from respiratory source from one person to another, they are example of propagated. And remember, propagated will always have secondary wave, and propagated will also take more than one incubation period time. But here there will be a secondary wave. So these are the 3 epidemic and their example. Do remember that. Mother and child linkage. Is it primordial, primary, secondary, tertiary? Which level of prevention? So mother and child linkage, these are example of health promotion, because health promotion have both the thing primordial plus primary. If it is primordial and primary both, then we call it health promotion. So how come mother child linkage is both? Let me explain it with a very simple example. Imagine me as a breastfeeding lactating mother. So I am breastfeeding my child. This breastfeeding is preventing my child from future risk of diabetes. And whenever the risk is in future and we try to prevent, this is primordial prevention when the risk is in future. Like if first second year student is preparing for MCI exam, this is primordial because he is preparing for a future exam. Now again I am the mother who is breastfeeding my kid, but this time from different breast. From 2 hour, for 2 hour we change, and from one side we should breastfeed for 20 minutes so that hind milk, last part of milk with fat high percentage, should also go to the child. So I'm again breastfeeding. Why I'm hitting? Because it is biting my nipple in between. So this time my breastfeeding is protecting my child from present risk of malnutrition. If I do not breastfeed my child today, he will be malnourished today. So this is primary. Primary means risk is present already. For example, all of you student, if you are watching this video just before exam, this is primary, because now the risk is present, only 6-day exam is there. So this is primary when you are preparing in final year. When you are preparing first year, second year, it is primordial when the risk was in future. And both primordial and primary is done when the disease is absent. The risk is there, but disease is not there. So these are in pre-pathogenesis period. And you can see by breastfeeding, I am preventing my kid from future risk of diabetes, primordial, and present risk of malnutrition also, primary also. So because it is primordial, primary both, so we call it as health promotion. And I still remember when my younger sister sibling Riddhi was there, she was very healthy kid. Whenever I used to take her in my lap, she used to turn my t-shirt कि मामा रखे तो तुम भी वो पिला नहीं रहे हो, है ना, कि mama you also have breast, you are not feeding me. So she used to turn 2 of my t-shirts, she torn away. Now what I can told to her कि पगली क्या फायदा है ना, nothing will come out, but she used to feel there is something and mama is not giving me. So I hope primordial primary is very clear. Always remember one question come again and again from secondary, that they will give example of screening test. All screening test is done for early diagnosis, and early diagnosis and treatment are secondary. So if they will write this question कि we are doing BP, son took his hemiparesis father for checkup. So hemiparesis father, as soon as we think, we write tertiary, but he is taking the father for checkup, and checkup means screening test, so it is secondary. If son took hemiparesis father for physiotherapy, physiotherapy will be tertiary, है ना, not checkup. Checkup will always be secondary. So similarly, if I ask this question, BP of healthy adult, what is this prevention? Can you answer this question? This is my question to you. BP of healthy adult, primordial, primary, secondary, tertiary. Where will you put this BP of healthy adult? Which level of prevention? And similarly, they can create this question also, that if right now, suppose today, not today, before rainy season, I clear the drainage area, which level of prevention it will be? So if I am cleaning the drainage area before rainy season, it means I am trying to prevent dengue before rainy season start. Before rainy season, cleaning drainage will be primordial. But if I am preventing larva bleeding by giving Gambusia fish or Temifos abate larvicidal drug, and there are 3 larvicidal drug which has been asked: Temifos, abate, Paris green, and Gambusia guppy are larvicidal fish. So if we are using larvicidal fish or tablet, that is risk is present, primary. And if we are killing adult mosquito, this is like secondary. We are, or if we are treating patient of malaria, that is secondary, and you can say like that. So preventing drainage area is primordial. Larvicidal drugs like Temifos abate, Paris green, or fish Gambusia guppy, they are primary. Chalo, answer this question. BP of healthy adult. We think BP of healthy adult can be primary, like some of you written it, but Himalayan and Mr. Unknown is correct, because it is BP is a screening test and all screening tests are secondary. So this is also secondary, because even if it is a healthy adult, why are we taking the BP? Because we want to do an early diagnosis. Healthy adult में पता लगाना चाह रहे हैं कि BP छुपा है कि नहीं. And whenever we try to do early diagnosis for hidden disease, it is always secondary. So BP of even a 10-year child is secondary. I hope you can answer this question from this level of prevention with this table only very well. One more question they have given, that there is an image of filariasis patient foot care. So whether it's filariasis or leprosy patient foot care is trying to limit the disability so that the patient can walk by himself. This is disability rehabilitation and disability limitation. And whenever we do disability limitation or we try to make the person self-dependent, rehabilitation, these are example of tertiary level. So filariasis patient foot care, disability limitation. Similarly, if I ask refractive error glasses, which some of you might be wearing. So the glasses which we wear is to limit our disability and to make us self-dependent, rehabilitate. Refractive error glasses will be secondary. But if you do LASIK surgery, that is treatment, that will be under secondary. Similarly, if you are giving hearing aid to old age people, because you know ना, सारे बुढ़े लोगों की एक ही परेशानी है, उनसे कुछ भी बोलो, मोस्टली वो एक ही जवाब देते हैं, आई आई, है ना. Many old age people, they don't listen, they just reply by I. So to them, if you are giving hearing aid is making them self-dependent, rehabilitation, so it is tertiary. But if you are doing cochlear implant is like a therapy, just like LASIK surgery. This all two things will be under secondary. Okay, so I hope you will remember all this also. Plus, yes, okay. Now, next, this question came already. Healthy adult undergoing blood pressure checkup. I already asked it. This is secondary because all screening tests come under secondary. Then, this unmet need of contraception. Is it for couple having 2 children? Is it used for couple having more than 2? Is it for newly married couple, or is it used for any couple? Unmet need of contraception is for any couple, married or unmarried, who don't wanted to have pregnancy but still had pregnancy. So their contraception need remain unmet, unfulfilled. All these 3 couple which are married and female should be between 15 and 49 years. Female should be in reproductive age group. This all couple are known as eligible couple. They are eligible for contraceptive advice. They should be married and adult female should be there. Okay. And do remember one factor, that whenever this couple protection rate becomes 60%, that means suppose you went to a village as medical officer in charge and you found there was 100 married couple whom I can give contraceptive, and out of that 100, if 60% took your contraceptive, then unwanted children will not be there. And when unwanted children will not be there, then every couple will have 2 child per couple. Every couple will have 2 child. Of course, some couple will have 3, some will have 1. So when you take average, it will come 2 child per couple. And whenever there is 2 child per couple, they ask this question: for couple with 2 child, what should be the net reproduction rate? Net reproduction rate should be equal to 1. हम दो हमारे दो के लिए NRR 1 होनी चाहिए. Okay? Why? Because NRR is simply girl child. How many girl child is there per female? And we subtract those girl child who died before becoming adult. Girl child considering mortality rate. Considering mortality, age specific mortality rate. So, if I am saying that NRR is 1, NRR is 1 means every couple has roughly 1 girl child. And because X and Y chromosome are 50-50%, so if everyone has 1 girl child, then they will also have 1 boy child on an average. 1 girl, 1 boy, that means 2 child per couple. So whenever NRR is 1, there is 2 child per couple, and the NRR definition should have 2 terms in it: girl child and mortality. If both the words are written in the question, only then you will take it as net reproduction rate, NRR. What I was saying in English was, सीधी सी बात मैं ये कह रहा था कि गांव वालों में 100 में से 60 को भी बांट दो ये कॉन्ट्रासेप्टिव, तो अनवांटेड बच्चे नहीं होंगे. हर एक के लगभग 2-2 बच्चे हो जाएंगे. और जब हर एक के 2-2 बच्चे होते हैं तो लड़कियां उसमें से सिर्फ 1 होती हैं, क्योंकि XY क्रोमोसोम 50-50% है और लड़कियों का नंबर पर फीमेल कितना है, इसी को NRR कहते हैं. तो NRR 1 का मतलब हुआ हर कपल के 2 बच्चे, और ये तब होंगे जब 60% कपल कॉन्डम या कॉन्ट्रासेप्टिव यूज करेंगे. तो रिमेंबर दिस 3 लाइंस. I was saying the same thing in English, Hindi. And do remember one more thing कि NRR आप तभी एग्जाम में टिक करेंगे जब दोनों चीज क्वेश्चन में लिखा हो: गर्ल चाइल्ड पर फीमेल कंसीडरिंग मोर्टालिटी. मोर्टालिटी वर्ड और गर्ल चाइल्ड दोनों लिखा है, तब NRR होगा. अगर उन्होंने दिया सिर्फ ये लाइन कि गर्ल लाइफ बर्थ पर फीमेल, मोर्टालिटी वर्ड हटा दिया, गर्ल लाइफ बर्थ पर फीमेल बोला, तो यह है ग्रॉस रिप्रोडक्शन रेट, GRR. If they written girl life birth per female, it is GRR. If they write girl child considering mortality per female, mortality and child, then it is NRR. If they remove mortality and added girl live birth per female, it becomes GRR. And then what is TFR and GFR? I hope you all know. TFR is total live birth per 1000 फीमेल. 1000 माओं ने कितने बच्चे पैदा किए उसको कहते हैं जनरल फर्टिलिटी रेट. और अगर 1000 माह की जगह हम सिर्फ एक माह की बात करेंगे तो होगा टोटल लाइव बर्थ, TFR, टोटल फर्टिलिटी रेट. सो टोटल फर्टिलिटी रेट क्या है? टोटल लाइव बर्थ पर फीमेल. देखो बहुत आसान सी बात है. एक माह ने कितने बच्चा पैदा किए? TFR. 1000 माह ने कितने बच्चा पैदा किए? GFR. तो जहां क्वेश्चन में 1000 दिखे GFR मारना, TFR नहीं. और अगर टोटल बच्चे की बात है, एक माह का TFR, 1000 माह का GFR. अगर गर्ल की बात होगी और एक माह का गर्ल पूछेगा, एक माह की कितने बच्चियां, तो GRR. एक माह की कितनी बच्चियां माइनस जो मर गई मोर्टालिटी, तब NRR होगा. तो व्हाट आई वाज सेइंग इन हिंदी वाज, one female, how many girl child? GRR. One female, how many girl child minus mortality? NRR. And one female total child? TFR. 1000 female total child? GFR. So if you got this question, most common question is this. If they ask 1000 female, how many total? Don't write TFR. This is GFR. And what is the target TFR of India? Target TFR of India is 2.1. We want every mother of India to produce 2 and 0.1 children. How will they produce 0.1? Someone will produce 3, someone will produce 5. Average will be 2.1. And what is the current TFR of India? 1.9. So we are producing less children than our target. Do produce more children. There is no problem of population growth in India anymore. It's gone. It's old problem. Problem is lack of rural development, because of which city are overcrowded. Population is not anymore a problem of India according to Government of India data. Chalo, which program logo is this? This is logo of United Nations Development Program, not WHO. WHO will have a snake and ladder in it. And this UNDP, UNICEF, both have headquarter in New York. New York also have headquarter of one more organization, UNFPA, United Nations Fund for Population Activity. This question has been asked in MCI exam, all 3 questions from this topic. Who fund family program? So family program are funded by UNFPA. Who fund sustainable development goal? Sustainable development goal funded by UNDP. Who fund seed and manure of applied nutrition program? Seed and manure of applied nutrition program funded by UNICEF. Do remember. And who fund maternal child health program? Maternal child health funded by UNICEF. Sustainable development goal, development here, UNDP also development. So development, UNDP SDG, UNICEF seed and manure. FPA, fund for population activity. So population activity means family planning. So it's easy to remember. Then also remember this 3-4 more small thing which they keep asking. What does CARE Foundation fund? So CARE is most needed by children, and CARE Foundation keep care of children by giving them food. So Anganwadi and Integrated Child Development Scheme is funded by CARE Foundation. Then they have already asked what is funded by Ford Foundation. So Ford Foundation fund sanitary latrine and knee-high program. knee-high is National Institute of Health Administration which is in Kolkata. तो ऐसे सोचो कि किसी ने इतना हगा, इतना जोर का हगा बुड़ुम बड़ाम की सैनिटरी लैट्रिन फोड़ डाला. Someone did this big shit and broken the sanitary latrine. After that they need to take bath na. Bath in Hindi is knee-high, है ना? So they take after bath. So क्या हुआ? फोड़ा किसको? सैनिटरी लैट्रिन फोड़ डाला. केयर किसको किया? बच्चों को. केयर इज नीडेड बाय आंगनवाड़ी, फोड़ सैनिटरी लैट्रिन. देन दे हैव आस्क्ड हु फंड कोबाल्ट थेरेपी यूनिट. सो दिस cobalt therapy unit, very easy to remember. If you see, it is CO therapy unit. You can see CO written here, and it is funded by which program? This is funded by Colombo plan. So CO, cobalt Colombo. And Colombo plan also give fund from New Zealand by Rajkumari Amrita Kaur, who is our first health minister, and funded AIMS New Delhi by using fund of New Zealand. Colombo plan also fund agricultural development. Last thing they can ask is, what does Rockford Foundation fund? So Rockford Foundation want to make our foundation rock solid by funding National Institute of Virology, which is in Pune. Because if we have virology research, then our vaccine will get the patent, our drug will get the patent, and we will earn crores of rupees. So Rockford is making foundation solid by funding virology, National Institute of Virology, and research on vaccine. So Rockford, Colombo, Ford Care, do remember. Chalo. Next is that in an acid-fast bacilli, how many bacteria should be there in 1 ml that you can find, then you can give Jaden smear positive result. So for Jaden smear positive, more than 10,000 bacteria should be there. If one sputum should have 10,000 or more, only then Jaden smear come positive. That's why Jaden smear can miss some case, it is less sensitive. Which is more sensitive? CB-NAT is more sensitive because it can detect at very less bacterial load. Okay. And in Jaden smear, they can ask the sequence of thing we add, which can be remembered by the song Kaal. Is Kaal Kaal mein hum tum kare dhamal, hai na? So what are the 3 things we add? First we add carbol fuscin, then we add acid alcohol, and last we add is Loeffler's methylene blue. And by adding these 3 things, if there is blue color bacteria being found, it can be either leprosy or TB bacteria. Because leprosy, TB have mycolic acid in their cell wall. So acid alcohol do not decolorize them, do not remove their color. So it looks like they are acid lover bacilli. That's why they call it acid fast, acid lover bacilli. They do mycolic acid in their cell wall. TB and leprosy. Loeffler's methylene blue is the third reagent. Okay. Kaal kaal mein hum tum kare dhamal. Next question. Sentinel surveillance. See, in HIV we do sentinel surveillance. Sentinel means active plus passive. Both. Active case search we do for hidden case. Like I already discussed in malaria, MPW do active surveillance, search for hidden case of malaria in the village once in 14 night. Passive means cases who are coming to hospital by themselves and getting them notified. जो खुद से आके रिपोर्ट करे वो पैसिव है. Active plus passive is sentinel. And so sentinel tell about hidden plus notified. It tell about everything. So it does include notified case. It include notified case. Okay, and it is not through subcenter report. Subcenter report will only tell about passive. It is not done by Anganwadi worker. It decrease reporting bias, not increase it. One more good question came was in INI-CET recent exam, that when the Kumbh Mela was made, there was a team of 1 doctor and some lab technician were roaming around in the van. So what they were doing? Are they finding case and treating them, or are they doing surveillance to detect outbreak early? So their main purpose of moving van was surveillance, sentinel surveillance mainly, and that is mainly surveillance to detect outbreak quickly. And if they detect outbreak has to be reported within 24 hours. Okay. Next question, incubation period for diphtheria, it is 2 to 6 days. Diphtheria is 2 to 6 day incubation period. And do remember, maximum incubation period, this is the duration for quarantine. So if I ask, what is the quarantine period for diphtheria? Will it be 2 days or 6 days? Maximum incubation period is quarantine. So quarantine for diphtheria is for 6 days, maximum incubation period. And quarantine is done on healthy people who are suspected of carrying infection. Whereas isolation is something which we done on disease people which are already having symptom, they will be isolated. Until which time they are isolated? They are isolated till period of infectivity. Till they can infect other, they will be isolated. And in case of chicken pox, isolation period is 6 days. And do remember, in chicken pox, if chicken pox occur in your hostel, boy hostel and all, we don't give varicella zoster immunoglobulin to adult people or boys hostel. Varicella zoster immunoglobulin first preference is given to pregnant lady. Okay, it is given within 48 to 72 hours. Now question is, what is the minimum space of work for each worker in factory act? 500 cubic feet and only 14 feet above head counted. हुआ क्या कि भैया इसमें जैसे बोला कि 500 क्यूबिक फीट स्पेस एक वर्कर को देनी है, तो फैक्ट्री के चालू मालिक लोग छत बनाने लगे ऊपर ऊपर, बोले कि देखो हो गया 500 क्यूबिक फीट। तो सरकार बोली नहीं, केवल सर के ऊपर 14 फीट नापेंगे, बाकी नहीं नापेंगे, है ना, बिकॉज इट वाज क्यूबिक फीट. सो ओनर स्टार्टेड मेकिंग रूफ टॉप वेरी हाई, saying this is 500 cubic feet. Then government say no, only 14 feet above head will be counted. If similarly they ask minimum space for kid in school health program, then the answer will be 10 square feet. And which type of desk are there in school health program? Minus desk is there. Minus desk in which leg can go inside and they can write without backache. We already discussed this. 2 child per couple is when net reproduction rate is equal to 1. If net reproduction is more than 1, population is expanding. जैसे मान लो मैं एक माँ हूं और मैंने लाइफ में 2 बच्चियां पैदा की, तो अब दोनों और बार बार बच्चियां पैदा करेंगी तो पॉपुलेशन बढ़ेगी. If I produce 2 girl child, they all will produce more girl child and population will expand. If NRR less than 1, population is declining. If NRR is equal to 1, then population is stable. And as I said earlier, if we are giving 1 out of 4 method of contraception to 60% couple, not 80%. If couple protection rate is 60%, then NRR is equal to 1. Okay, chalo. Then in Anganwadi plain area, one Anganwadi is in 400 to 800 population. Anganwadi in at 400, 800, and in hilly area, one Anganwadi is in 300 to 800. This is hilly area. This is plain area. But if it is mini Anganwadi in hilly area, it can be at 150 to 300. But mainly they will ask one Anganwadi, 400 to 800. Similarly, they ask one ASA. One ASA is at 1000 population, written in 3 places in Park textbook. Minimum education of ASA, if they ask, remember minimum education is 8th pass, not 10th pass. 3 places in recent edition of Park they have written 8th pass. Why some teacher teach 10th pass? Because if Kerala government has to release the advertisement on Google, they will write we need 10th pass. But if exam setter has to create question, they will look at Park, not Google. So 10th pass is not national guideline. 10th pass is state, Kerala and other state demand. 8th pass is national guideline, written in 3 places in Park. So remember, one ASA 1000, how much education? 8th pass. And if it is Usha is 1000 to 2500 population. Okay, chalo. Next question. Suraksha Clinic logo, remember, one time they gave the same logo, people answered Red Cross. No, Red Cross has red inside. This is dot inside is Suraksha Clinic. Suraksha Clinic treat sexually transmitted disease patient. It treat STD patient. And in the Suraksha Clinic, there is medicines always come from government. Yeah, iska nib toot gaya. Medicine, Nikhil, give me second name. Medicine do not come from private. In Suraksha Clinic, plus, do remember this question, mobile medical unit is there in Rajasthan area to take medicine to peripheral area. In mobile medical unit also and Suraksha Clinic also, medicine only from government. Always remember. Chalo, next question. Which of the following indicator is used in Anganwadi? Wow, ready, next pen. Thank you, Nikhil, bro. तोड़ ही डाला मैंने. So, in Anganwadi, if you want to know growth monitoring, first of all, tell me in Anganwadi up to which age children come? Up to 3 year, 4 year, 5 year, 6 year. Up to which age children come? 3, 4, 5, 6. Now, the second point is, इसको खोलना जरा. कि in Anganwadi, we want to know both the thing, whether the problem is chronic or problem is acute. And when it is wait for age detect both chronic and acute problem. Because if there is a malnourished child and malnourished child is not getting food since birth, suppose I am a malnourished kid, imagine me as a malnourished kid, and suppose my mother is not feeding me from birth, so that is chronic problem, I can have low weight due to it. Or acute is, let's say my wife is not feeding me since my marriage, or maybe my wife and mother are together trying to keep me malnourished, है ना? So it can be chronic and or acute. And or acute means it can be either chronic or acute or both. So why we use weight for age? Because weight for age tell both chronic and acute. If it is height for age only tell about chronic malnutrition. It only tell about stunting. This question has also came. And if it is weight for height tell about acute malnutrition. Weight for height is wasting. अगर कोई लंबा है और सूख गया तो इसका मतलब कि बचपन में ठीक खाया है तो लंबा हुआ है, अब नहीं खा रहा है, प्रॉब्लम एक्यूट है. If someone is very tall and thin, it means since birth he is eating well, there is no chronic problem, but the problem is for last 1-2 months, acute problem is there. So weight for height, if it is low, that is acute malnutrition wasting. And in the criteria of SAM, severe acute malnutrition, weight for height is something which is less than -3 standard deviation. And mid-arm circumference is less than 11.5 centimeter, which is red in color. And the last criteria is there should be visible wasting or edema. बच्चा देखने से ही सूखा हुआ या फूला हुआ लगेगा. So remember the criteria of severe acute malnutrition is weight for height less than -3. Now what is the answer? देखा ना खोल के? Yes. 5 year, 4 year is the answer which I am getting. Correct answer is 6 year. आंगनवाड़ी में बच्चे 6 साल तक जाते हैं because in village area school starts usually from 6 year, plus this is an old program, 1976 program. At that time after 6 used to go to school, so it is 6. Which line is most important? Death certificate, line 1C. Why? Because this tell about the main underlying cause of death. इसी के चलते सबसे मेन बात पता चलती है, इसलिए यही सबसे इंपॉर्टेंट लाइन है. For example, if I went outside, I have an accident and truck went from my stomach. So in line 1A, you will write hypovolemic shock as my cause of death. This hypovolemic shock occur due to, let's say, spleen rupture. Line 1B, we write immediate underlying cause of death. 1A, immediate cause, hypovolemic shock. 1B, immediate underlying cause, spleen rupture. 1C, you will write road traffic accident. Main cause is accident, which you will put in 1C. And in 2, you can put HIV, my secondary problem, or obesity. And it's not कि ट्रक वाले ने मेरा तोन देखा और अट्रैक्ट होके इधर आके मुझे ठोक दिया. And it's not that truck driver was attracted due to my obesity and killed me. So in line 2, we write any other cause not directly leading to death. That is line 2. Okay? Chalo. Now, this is RBC with microcytic hyperchromic anemia. This is very characteristic of basophilic stippling. And basophilic stippling is lead poisoning, plumbism. Second thing they ask in lead poisoning is, what is the most common route of lead poisoning? Most common route is inhalation. By smelling it come. Second thing they ask is, if you found in urine alpha aminolevulinic acid, or if you find coproporphyrin in urine. So alpha aminolevulinic acid and coproporphyrin in urine, they are the two sure short sign that someone is suffering from lead poisoning. And what is the drug of choice which we give for lead poisoning? Drug of choice is ethylene diamine tetraacetate. So this was MCI question last year only. Aminolevulinic acid in urine, lead poisoning. Plus in plumbism or lead poisoning, there will be blue line on upper gum. This is Burtonian line on gum. So image based question can also come from this Burtonian line. Okay, very important topic, lead poisoning. Forensic, PSM both ask. Holder method is 63 for 30 degrees holder, 72 degree for 20 second, not 50, 20 seconds. This is high temperature short time. How will you remember it? Very simple. 72 and 2. There is 2. So 72, 20. And it is TT also. TT, 2. So 72, 20 high temperature short time method. This is known as flash method. And holder means we are holding for long time. So it is 30 minutes. So you can see here 3 here also, 63 3 here also. So if you find 3, it is holder and VAT method. Then they ask which test is done before pasteurization. Before pasteurization, we can do methylene blue test. Okay, methylene blue test. Chalo, next question. What is this measuring? This is measuring weight of the child. This was an old instrument known as Salter scale. We used to hang the child from here and measure the child weight from this Salter scale in our old time. If they have teeth-like thing coming out and copper wire, this is multi-loads 375, which is second generation IUCD. Progesta CERT or Mirena, these are third generation IUCD, and third generation IUCD have hormone in it, and hormone is a liquid. So Progesta CERT and Mirena will be T-shaped, but they will always be a plastic thing will be there. Plastic IUCD will be there, because only under plastic you can keep the liquid of hormones which are in third generation IUCD, है ना, क्योंकि third generation में हार्मोन है, तो plastic वाला IUCD third generation होगा. Okay, third generation will always have plastic container to contain hormone in it. And if it is first generation, image based question has already came from first generation. First generation is Lipley's loop. अगर आपको ऐसा कोई सांप बना हुआ IUCD दिखाए, this type of snake like IUCD they gave, that is Lipley's loop, first generation IUCD, and you can see there is no point of attachment. So Lipley's loop has very high expulsion rate. It used, ये loop से निकल जाता था, है ना, it comes out very quickly. So because of high expulsion rate, we have stopped using this Lipley's loop anymore. It's no used. Chalo, next question. Kit number 2, which is green color, is used for vaginitis. If they say cervical erosion and vaginal discharge, in which category you will put it? Kit 1 or Kit 2? Cervical erosion, vaginal discharge. Vaginal discharge is second kit green. And cervical erosion is the same thing as cervicitis. And if there is cervical infection, discharge will come out only through vagina, na? So if it is cervical erosion plus vaginal discharge, it means the infection is in cervix, and this will be Kit 1 gray. So if it is cervical erosion plus discharge, gray. Only vaginitis, only vaginal discharge, then Kit 2 green. Okay. And what is the most common kit? Kit 6. Kit 6, which is yellow color, is given for PID lower backache. This is most common. Okay. A population is 1 lakh under surveillance. 100 cases were positive for malaria thick smear. What is annual parasite index? API is having this simple formula. API means out of total population of 1000 people, how many confirmed case of malaria occurred? Confirmed case of malaria. And API tells us about impact of malaria control program, whether malaria control program is able to decrease malaria or not. Because suppose in any village or state, last year API was 4 per 1000. This year API is only 2 per 1000. It means malaria impact is good. API tell us whether malaria program is decreasing malaria or not. Impact. API impact. And here in this question, confirmed cases were 100. They have written 100 cases were confirmed. Confirmed cases 100. Population was 1 lakh. So 100, then 30. Multiply by 1000. This is the formula. So when you will do the multiplication, it's quite obvious that this 30 will cancel this 30. 100 will cancel this 100. Answer will be 1 per 1000, because API is always measured in 1000. Now, do remember, if API is equal to or more than 1 per 1000, it means this state belong to intensive control phase. Many a time they ask this definition. What is the definition of intensive control phase? So intensive control phase means 1 case per 1000. Second question from this topic in MCI exam already asked is that which tell about recent transmission of malaria. आपको मान लो पता लगाना है कि आपके एरिया में मलेरिया पिछले साल फैला कि नहीं, तो पिछले साल का पता लगाने के लिए आप क्या कर सकते हो, कुछ 1 साल से छोटे बच्चों का ब्लड ले लो, क्योंकि अगर 1 साल से छोटे बच्चों के ब्लड में आपको पैरासाइट मिल गया तो उनकी तो उम्र ही 1 साल है, पक्का मलेरिया पिछले साल रिसेंटली फैला होगा. सो व्हाट आई वाज सेइंग इन हिंदी वाज, if you want to know malaria is recently spread in last 1 year or not in your area, just take infant blood sample, because infant age is less than 1 year. So if in their blood you found malaria parasite, it means definitely malaria is transmitted last year only. So this is infant parasite rate which tell about recent transmission. Last thing they ask is which tell about operational efficiency or efficiency they ask. किस इंडिकेटर से पता चलेगा कि लोग जमीनी हकीकत में काम कर रहे हैं कि नहीं, स्लाइड बना रहे हैं कि नहीं, तो उसी से पता चलेगा कि काम की ऑपरेशनल इफिशिएंसी क्या है, which will tell about whether people are making slide or not. Reality of the program, that is annual blood examination rate. Because what is annual blood examination rate? How many slide you are making from fever case divided by population multiplied by only 100, not by 1000. So ABER tell us whether people are making slide or not. This is last year UPSC question. Efficiency or operational efficiency which tell us ABER. Impact which tell us API. Recent transmission which tell us infant parasite rate. So this is very useful. Every slide which I am discussing, fortunately or with practice, you can say all the slides is giving you 2-3 information. So I am finding it very useful session till now as for you, and based on what are the expected topic from which question come. They ask this question from sentinel surveillance, which state is moderate prevalence. So moderate prevalence means HIV is more than 5% in high risk, but in antenatal women less than 1. This is the criteria for moderate prevalence. See, in high risk group, there are sex worker. In them, we already expect HIV high. So that is 5%. But if HIV is more in ANC mother, it means HIV has already spread in general population. It is very dangerous thing. So we first want to decrease ANC mother less than 1. Then we will focus on sex worker. Okay. Second question which they ask from here is, which are not included in HIV sentinel surveillance? This is 2-time question in INI-CET and 1 time in NEET exam. I am expecting it in this exam. This INI-CET only they ask question from this topic. HIV sentinel surveillance when we do, first of all, there are high risk group. And in the high risk group, there is 4 people. One is sex worker, other is transgender, third is male having sex with male, and fourth is intravenous drug user. Do remember, doctor do not come here, because you have not performed like sex worker. You need to increase your performance, then you will come in high risk group. Second group is bridge population. Bridge population are single migratory worker and long distance truck driver. So they are bridge because they go to sex worker and then they spread it to their innocent wife at home. So ANC mother is the 7th person. 6th is migratory worker, and 5th is truck driver, long distance truck driver. Then 4 are these 4 people. Do remember the 7 people. They will ask which is not in sentinel surveillance. Like sex clinic attendant, they don't include in sentinel surveillance. They can give any option other than this 7. So remember these 7. Okay. Next question. That if we want to report acute flaccid paralysis, AFP is acute flaccid paralysis, acute flaccid paralysis reporting occur to know whether we are correctly checking for polio case or not. Acute flaccid paralysis minimum reporting should be 1 per lakh. If we are not reporting 1 per lakh case, it means we are not detecting for polio properly. Okay. Next question is, what is Ujjavala? Is it the LPG cylinder which Modi give to poor below poverty line people? Or is it female child protection, or it preventing child trafficking and rehabilitation? So very easy to remember. In Ujjavala, there is a jaw. And what is the role of jaw? Jaw catches food and take it to stomach. So similarly, Ujjavala is to catch children who are smuggled or removed from house and then help in their rehabilitation. So when you found jaw, that is trafficking and rehabilitation. This Modi distributing LPG cylinder with one-time gas for BPL family, this is Ujjwala. Ujjwala, not Ujjavala. Ujjwala. Okay. So do focus on jaw, that is child prevention. Next question, for urban malaria, what is the best strategy? Urban malaria best strategy is covering overhead water tank, because in urban area many tanks are open, which is a fresh ground for mosquito breeding. Second best is cleaning of drainage area and water supply area. This is second best. First is overhead water tank collection. And if they ask best rural malaria control strategy, not urban, rural malaria best control strategy, then for rural malaria it is intermittent irrigation. रुक रुक के सिंचाई. होता क्या है कि गांव में लोग धान के खेतों में बहुत सारा पानी डाल के छोड़ देते हैं, जिसमें मच्छर उग जाते हैं आसानी से. सरकार कहती है पहले 3-4 दिन पानी दो, फिर रुक जाओ, फिर पानी दो, फिर 3-4 दिन दो, रुक रुक के सिंचाई करो, मच्छर कम पैदा होंगे. What I was saying in Hindi was, you must have seen in paddy field, villagers put this much water, which lead to mosquito breeding. So government tell them, give water for 3-4 days, let it dry, intermittent, stop, then again give water for 3-4 days. This type of irrigation is intermittent irrigation. It will prevent less mosquito breeding in paddy field. Okay, so this is best for rural malaria. For urban malaria, covering overhead water tank. In this program, you can see a very talented doctor who is using his stethoscope to find some heart defect in the child. And he is posing also at the same time, detecting heart defect also same time. Who is this doctor? Who visit government school and detect for heart wall defect, another thing? That is Ayush doctor, who is detecting under which program? Rashtriya Bal Swasth program. He is doing a screening of children for 4D. Defect since birth, developmental anomaly, deficiency disease, and disease of childhood. And congenital glaucoma, zinc deficiency do not come under it. Here, you can see more than 10 warmer for the kid. So, if there is more than 10 warmer, this is newborn special care unit with 12 to 16 warmer. This is at district hospital. Okay. District hospital, you have newborn special care unit. Newborn care corner is 1 bed for newborn at PHC. And newborn stabilization unit is at CHC with 6 to 8 bed. This program is known as India Newborn Action Program, INAP. India Newborn Action Program. So in this India Newborn Action Program, government said that we should give more warmer for preventing life of children. So it's very easy to remember. We all know first PHC come, then CHC, then district hospital. 1, 6, 12. PHC, CHC, district hospital. And again, see, first we will give care at PHC. If care do not work, we will try to stabilize the child at CHC. And if child is not stabilized, he needs special care, which we give at district hospital. So how to remember it? Very simple. 1, 6, 12. 1, 6, 12. Then PHC, CHC, district hospital. Then care, stabilization, special care. Like that you can remember. 1, 6, 12, PHC, CHC, district hospital. Care, stabilization, special care. This is known as India Newborn Action Program. One more program which I am expecting and they can ask is this 𝐒𝐿𝐾𝐄 program. What we do in 𝐒𝐿𝐾𝐄 program? In 𝐒𝐿𝐾𝐄 program, we improve the facility in labor room and maternity OT and maternity ward. So labor room is for maternity OT and maternity ward and labor room facility improvement. If you are training doctor and nurses to decrease delivery related death, this is known as dakshata. Dakshata means highly skilled, where we give training to prevent delivery related death in mother. And if you decrease infant death by increasing bed capacity, this is India Newborn Action Program. In the logo of INAP, you can see one child sleeping on a warmer. And if you give money for government hospital delivery, this is done in Janani Suraksha Yojana, JSY. And this money is given to mother and ASA USA both. Plus, they can ask about one more program, which is RMNCHA. This was RMNCH plus A. So RMNCHA, they will ask which age group is not covered. Old age is not covered. RMNCHA, old age geriatric population not covered. Because what does R stand for? Reproductive. M stand for maternal. M stand for neonatal. C stand for child. H for health. And A for adolescent. So we are covering everyone except old age. RMNCHA do not cover old age. Next question. This is Ayushman Bharat. We already know it has PMJ, Health and Wellness Center, and a school health program under it. Then this is a question based on paired test, chi-square test, frequently asked topic. They said we have taken two group of children and I want to know among rural and urban, how many are malnourished. So malnutrition is a disease. And whenever they talk about disease, disease is just category. Like you can say malnourished, severe malnourished, moderate malnourished, not malnourished. So this is categorical. And category, when you can divide things in category, this is qualitative data. And whenever you have qualitative data of two or more group, then we definitely apply the test chi-square test. So answer here is chi-square test. Why? Because they are comparing disease. Malnutrition is a disease. Also remember, in some time question, hint, they will write percentage. For example, when we talk about anemia, anemia is a disease and I can say 5% of you are anemic. So percentage is used for qualitative data. Again, chi-square we will apply. In some question, they will say proportion. When I say 5%, 5% means 5 out of 100 is anemic. Again, it is talking about disease. Or if I use median and mode. So in any question, if they write median, mode, percentage, proportion, or any disease name, and then they are comparing, 99.9% time answer is chi-square. Simple. Okay. Then, if in some question, they are writing, let's say pre-post, before, after. So pre-post, before, after, or match word you found. This is paired t-test. If you found pre-post, before, after match written in any question, it is paired t-test. But paired t-test is used for those data which are quantitative. And quantitative data are those which we can measure. Like we can measure BP, we can measure HB. We cannot measure anemia, we cannot measure hypertension. Anemia, hypertension are disease, they are chi-square test, qualitative data. But BP, HB, weight you can measure. Obesity you cannot measure. And obesity is qualitative. BP, HB, they have asked cholesterol, these are quantitative, because we can measure BP, HB, cholesterol, my weight. And in measuring weight, if I am measuring weight before giving drug, after giving drug, by which test you will compare it? So this time you will compare it by paired t-test. And if I am measuring weight in two group of people, then we will apply unpaired t-test. And I am not measuring weight before, after this time. If I will measure it in two group before, after, answer will become paired t-test. I am just measuring weight in two group after 6 months of treatment, not before, after 6 months, two group. We call it unpaired t-test, which is same as a student t-test. And if there is 3 or more group, then we apply ANOVA. 3 or more group, ANOVA. Okay. So these 3 tests we apply for those data which we can measure, like BP, HB, height, weight, cholesterol. And those data which just we put in category, for them we apply chi-square test. Okay. Chalo, next question. data about immunization in any community come by district level health survey or DLHS or family level health survey, National Family Health Survey, NFHS. NFHS, DLHS give data of immunization, give data of breastfeeding, anemia, domestic violence, iodine deficiency. These 5 data come from NFHS, DLHS. SRS is known as double data recording method, very commonly asked question. Because in SRS, first data is collected by ASA worker, then some supervisor collect it second time, and then they confirm the data. So it is double data recording method. And in SRS, we get the data of infant mortality rate, maternal mortality rate. These data come from SRS. Okay. Census, remember, census do not give us death data. Census is done every 10 years, which is not done for last 14 years. Last was in 2011. And in census, we can get the data of sex ratio. We can get the data of socio-economic status of family. We can get the data of literacy rate of the country. But no death data come from census, remember. Okay. Chalo. If 2 live vaccine has to be given, minimum gap between them should be 4 weeks. If they are going to be given at the same place, then minimum gap should be 4 weeks. But if they are given at the different place, they can be given together. For example, MR and JE, both we are given at 9 months and then 16 to 24 months we repeat it. So on the same day we give JR and JE and MR, and JE and MR, not JR and MR, JE and MR. And JE in India, we are using live vaccine of the strain SA1414 2 bar. So live vaccine we are using SA1414 2 bar as 1414-2, and JEMR, both of these vaccine, both are given by subcutaneous route, and both dose are in subcutaneous route 0.5. So now the question is, they ask which one is given in left, which one is given in right arm, and we do not remember it under exam pressure, but it's very simple. M also stand for mother love, and mother love we all know is always right. So right arm is MR and left arm subcutaneous is JE. Second thing they ask is the diluent. The diluent of JE is phosphate buffer solution. So to remember it, it's very simple. If you write the full form of JE, Japanese come, and Japanese have J also, P also, Japanese. So JE phosphate buffer. Diluent of MR is sterile water, because again you can remember like this, mother love is like sterile water, distilled water na. No matter how angry is your mother with you, just press her leg for 20 minutes, she will melt like ice cream. So MR diluent, sterile water, JE phosphate buffer. And if they ask BCG diluent, it is normal saline. जैसे ही बच्चा पैदा होता है, हम उसकी जिंदगी थोड़ी नमकीन बनाने की कोशिश करते हैं, बिकॉज BCG 0.05 ml on left side intradermally we give at birth. So we try to make the life of child a bit salty as soon as after birth. That's why we are giving normal saline with BCG, making life salty. So diluent and route you must remember. Next question is open vial policy. There are some vaccine which we can use up to 4 weeks if you stored it adequately between 2 to 8 degrees Celsius. They ask which are those vaccine which follow it. So to remember it, just say it with me. Hep B, PCV, all tetanus, all polio. These are the open vial policy only. What are those? Hep B, PCV, all tetanus, all polio. Hep B, PCV, all tetanus vaccine, and all polio. Some teacher teach you that rotavirus also come under it. No, at least not in India. Clearly Park has written only this, and Park has written rotavirus MR do not come under open vial policy. Open vial policy means you opened it, you can still use it up to next 1 month if you store it between 2 to 8 degrees Celsius. So Hep B, PCV, all tetanus, all polio. We all know all tetanus means it will be DPT, it will be pentavalent, it can be DT, it can be TT, and pentavalent we all know has what are the 5 things? DPT plus Hib, Haemophilus influenza type B, and hepatitis B. These 5 things come under pentavalent. All polio means OPV and FIPV. Where do we give FIPV? We give FIPV 0.1 ml on right deltoid. Okay, right deltoid. So only these 4 category, PCV, Hep B, all tetanus, all polio, follow open vial. That means open vial policy apply to which? Hep B, PCV, all polio, all tetanus, but not to these other. Okay, chalo, next question. Which of the following ministry control the ICDS? ICDS have Anganwadi program under it, and this ICDS or Anganwadi program, previously it used to come under Ministry of Women and Child Development, but now it come under Ministry of Education. And under ICDS there is one program is Anganwadi, old program, but the other midday meal program is no more. Now midday meal is known as PM Poshan, and in PM Poshan, what is the new thing we have given? We have included preschool children. Those children who are less than 6 years, they will also get food in their school. How much food you will get? They will get half protein, 1/3 calorie. And this is confusing. People confuse and they ask it, which is one half, which is 1/3. But if you know the reality of India, you will not be confused. The reality of India is most part of the India, females are only eating rice. And with rice, they get calorie but not protein. So what we need to give to children and mother in Anganwadi and then children in a school, we want to give them more protein, half protein, calorie less, because calorie they will get at their home. And this is supplementary food. Main food is their home food. We are adding more protein because they are not getting protein at their home. So half protein, 1/3 calorie. So this is PM Poshan. Then one program I hope you all know is 𝐒𝐿. 𝐒𝐿 is the program for TB reporting. And this TB reporting is done by private and government both. Private, government both. Because 𝐒𝐿 means no, 𝐿 means loss of body TB. So TB reporting is 𝐒𝐿. But if I made it 𝐒𝐿 Poshan, Poshan word means nutrition. And previously in 𝐒𝐿 Poshan, they used to give 500 rupees. Now the new guideline is giving 1000 rupees per month for TB patient food. Previously it was 500, now it is 1000. And the third confusion come from Nischay. So Nischay is a Hindi word which means to be sure of. Nischay is the UPT kit given by ASA, because ASA want the mother to be sure of their pregnancy. So in Philippines, one student say that in Nischay, S is coming first as compared to 𝐒𝐿. So if S is coming early, S is for sex, sex is for pregnancy. That is UPT kit. So in this way, you can focus more. So Nischay is UPT kit. 𝐒𝐿, no TB is reporting. But if you add 𝐒𝐿 Poshan, it is 1000 rupees per month for TB patient. Okay, next question. Bilateral pitting edema. This occur after eating mustard oil with Argemone mexicana, bilateral pitting edema and congestive heart failure. These are symptoms of epidemic dropsy. Epidemic dropsy. And what is the poison in epidemic dropsy? Poison is sanguarine. How to remember it? Very simple. S for sleeping. So suppose you are sleeping with someone of your dream. First of all, you will not sleep. But if you slept after lots of hard work, then one thing, there will be dropping of eyelid, dropsy. And symptom is also pitting edema, going inside, dropping inside. So pitting edema, dropsy, sleeping, sanguarine, this can help you in remembering the whole picture. But in recent NEET, they ask which test detect it. And there is 2 tests, nitric acid, paper chromatography. So if they ask which is better test, so more sensitive is paper chromatography. And this is one area where even I do mistakes sometimes. More sensitive, but recently I have revised it from par. More sensitive is paper chromatography. So if they ask that out of nitric acid and paper chromatography, which one is a better test? Better test is paper chromatography. Second number is nitric acid test. Okay, nitric acid test. Chalo. Now let's look at the other option. Adulteration of crotalaria seeds with pyrazolidine, this will cause endemic ascites. देखो कितना आसान है याद करना. हम जानते हैं एसाइटिस में क्या फूल जाता है, पेट फूल जाता है. एसाइटिस लीड टू स्वेलिंग ऑफ पेट. पेट इज एब्डोमेन. So P for pate or abdomen swelling, ascites, and P for pyrazolidine. So pyrazolidine, pate swelling, and this is endemic ascites. Adulteration of saag, khesari saag, or saag nahi, mostly it is adulteration of arhar dal. If you mix arhar dal with khesari dal, it will cause neurolethyrism. And in neurolethyrism, 3 questions has been asked already. First thing is, what is the poison? Poison is boa beta oxalyl aminoallyl. Second thing, what is the treatment? Treatment is vitamin C. Third thing they have asked is that there was a farmer from rural part of Chhattisgarh eating only rice and pulses, and he developed spasticity of lower limb. Kada ho jata hai kya? Paon. So if you found spasticity of lower limb after eating khesari dal or only rice and pulses, spasticity of limb, and if you found cross leg walking on toe, क्रॉस लेग वॉकिंग ऑन टो, पांव क्रॉस करके चल रहे हैं आगे वाले हिस्से पर, क्रॉस लेग वॉकिंग ऑन टो, this is also symptom of neurolethyrism. Last thing which is being asked 2 times in MCI exam, that if someone is eating groundnut, मूंगफली में दाना नहीं हम तुम्हारे मामा नहीं, तो अगर कोई ग्राउंडनट और मेज कॉन्टामिनेटेड विथ एफ्लाटॉक्सिन खा रहा है, सो दैट विल लीड टू हेपेटोसेल लिवर सेल कार्सिनोमा. And they only ask what is the poison? Poison is aflatoxin. So remember this thing, if they eat groundnut or maize with aflatoxin, this will cause green color fungus aspergillus flavus release aflatoxin, and aflatoxin will cause liver cell carcinoma. Last thing is they can ask that if someone is eating wheat or rye or jawar with Claviceps purpurea black color fungus, this black color fungus Claviceps purpurea release a toxin, ergotoxin, and we have read about ergotamine group of drug which treat migraine. How they treat migraine? Migraine problem occur because vein got abnormal vasodilatation, so ergotamine cause vasoconstriction. So similarly here also ergotoxin is causing vasoconstriction, and as a result of vasoconstriction in this disease there will be cyanosis or necrosis of finger. So if you found cyanosis or necrosis of finger, the poison is ergotoxin and it is black color fungus Claviceps purpurea on wheat or rye. So these are 5 food poisoning. Please request before exam, do revise this 5 food poisoning for sure. Very important area of question. Okay. Now, which of the following is not a method of death reporting? We just read census do not talk about death data. Rest all are death reporting. Okay. This figure is showing white plaque deposition of teeth. This is example of high fluorine in water leading to dental fluorosis. They can ask the concentration of fluorine which can cause dental fluorosis. So dental fluorosis is when fluorine is more than 1.5, because in last exam they have asked that if there is brittle bone, suppose आप orthopedics लिए हो, आपके ओपीडी में एक बाबा आए और बोले कि डॉक्टर साहब सुबह टट्टी पे बैठ रहे थे, हड्डी चटक गया, टट्टी से उठ रहे थे, हड्डी चटक गया, है ना, while going to toilet or coming out from toilet I had fracture of bone. So if this type of pathological fracture is there, it can be due to high fluorine in water more than 10, which lead to brittle bone. What is the normal concentration of fluorine in water? That has been asked in one of the exam of MCI 4 years back. It is 0.5 to 0.8. This is normal concentration. And why it is easy to remember? Because the chlorine which we need in water is also around same 0.5 to 0.7. And this was the question just 1 year back in MCI exam, that what is the minimum amount of chlorine which should always be there in the water? This is known as residual chlorine, and residual chlorine should be 0.5. And for this residual chlorine, what is the duration for which we have to leave bleaching powder in water? We have to leave bleaching powder for 1 hour. In that 1 hour, bleaching powder releases HOCl minus ion, which is hypochlorous ion, and this hypochlorous ion is the ion which kill 85% of bacteria. So remember these 3 questions from chlorination. Residual chlorine 0.5, contact period 1 hour. Which ion of bleaching powder kill maximum bacteria? HOCl hypochlorous, जिसमें रस है, juice है. The one with rus or juice will kill maximum bacteria. So hypochlorous kill maximum bacteria. Okay, do remember. So it is due to excess of fluorine that white plaque deposit in the mouth. If there is deficiency of fluorine, that will lead to dental caries. दांत सड़ जाएंगे. So if fluorine is less than 0.5, it will lead to dental caries. So fluorine is a double-edged sword. It is dangerous in both lower and upper concentration. Next question is, if you want to know what is sensitivity, we just discussed. Sensitivity means how much out of disease we are correctly catching those who are actually suffering. True positive by disease. So percentage of true positive among total positive, if you look, true positive by total positive, this is known as positive predictive value. True positive by total positive. True negative by total negative, this is negative predictive value. The formula of negative predictive value is true negative by true negative plus false negative. But disease people out of who are those ill, percentage of disease people who are identified as ill. Identified as ill means जिनको आपने पकड़ लिया, those who came true positive, they are identified as ill. So this option B is saying true positive out of disease. This is the formula of sensitivity. And remember, we told you that is very easy to remember. Just remember true positive in the denominator, write true positive, and just opposite of that. What is the opposite of true? False. Opposite of positive, negative. So this will be helpful in keeping the formula forever in your mind. True positive by true positive was just ulta, false, negative. And you can remember the formula. Next question is, if you are investigating malaria by looking at every first and fourth house, if you are checking nth house, this is systematic random sampling. Like if you want to know villager are using condom or not, what do you think? Villager use condom or not? How come you know? You have not checked what is below their lungi, hai na? So if you are checking first and fourth house, this is systematic random sampling. Okay, but what is stratified random sampling? Stratified random sampling means in this researcher or the person who do the survey divide population first, divide population and then choose equal number from each subgroup. This is one question which came in NEET, then in INI-CET. This is very expected question in your recent MCI exam. They will give an example that we are dividing people and then choosing equal number from each subgroup. Which type of sampling is this? This is stratified random sampling. For example, if I am dividing people based on anything, if I am dividing people based on religion, based on what food they eat, in one example of NEET they gave that I have divided drug based on drug from animal origin, drug from plant origin, drug from fungal origin. So whenever you divide means you create layer, and layer is known as strata. So whenever you divide and choose equal number, that is stratified random sampling. Let me explain this thing with very simple example. Suppose I want to take 10 people out of the whole batch of 100 for a party after class. Suppose is the main word. One way is I can took name of all the 100 people and by lottery method I will choose 1 out of 100. This is simple random sampling. And this simple random sampling is best for homogeneous population. Homogeneous means who are similar to each other. Like students are similar for me. So I can do lottery method and choose any 10 out of 100. Simple random sampling. But if I choose any 10, out of 10 maybe I can get 9 boy or 8 girl. And what I want is that in that party, among that boy and girl, there should be some settings of love making, because I am happily married to children father. है ना. I want more love among you people. So I will divide you into boy and girl, and then I will ask 5 boy to come and choose and 5 girls to come and choose. So who is dividing? Researcher is dividing you in boy and girl. Which type of sampling? Stratified random sampling. And then I suppose ask you to give me any number between 1 and 10. 1 to 10. You gave me 7 number. I'm choosing every 7th. 1, 2, 3, 4, 5, 6, 7. Then 8, 9, 10. Then again 1, 2, 3, 4, 5, 6, 7. So if I'm choosing every 7th number, this is systematic random sampling. And if I'm choosing the whole back bencher or the whole front bencher, this is cluster sampling because I'm choosing the whole cluster. Okay. So I hope all the sampling is clear. Stratified, they will ask in this exam again. Be ready. Next question is, if the null hypothesis came out to be true, okay, null hypothesis came out to be true and was accepted, but in reality null hypothesis was false, which type of error is it? Is it type 1 error or alpha error, or is it type 2 error or beta error? So a lot of confusing and tough question they can ask, especially in July exam, because it is expected to be a bit more tough. So try to understand this concept. It is very simple to understand. Alpha error have almost same meaning. It is not exactly same, but same meaning as p value. And alpha error, p value, type 1 error, they all means false positive. False positive. And beta error means false negative. So let me explain this very simply to you. Suppose from your batch, one of my friend, let's say Dr. Siddiqui came. He want a party from me. So he came with a stethoscope, put his stethoscope on my tummy, and at the same time I had a bowel sound. That is bowel sound. But Dr. Siddiqui said, "Congratulations, you are pregnant. Give me party." So which type of report does Dr. Siddiqui gave to me? He gave me false positive report. मां कसम मैं मां नहीं बनने वाला हूं, सिद्दीकी ने मुझे मां बना दिया. मतलब उस तरह से नहीं, false positive report देख के मुझे मां बना दिया है ना. सिद्दीकी gave a false positive report and make me mother forcefully. So what is happening in case of my pregnancy? Actually, in my stomach there is no pregnancy. Actually, my stomach is null, is lull. There is nothing significant. So in my case, null hypothesis is true. I am not pregnant. But Dr. Siddiqui came and he, this is different. If Dr. Siddiqui came and he rejected null hypothesis, my null hypothesis, this is my stomach. Stomach has nothing except fat. So stomach is null and my null hypothesis is correct. But Dr. Siddiqui came and he rejected my null hypothesis, said it is not null, there is some pregnancy. So this is alpha error p value. What is alpha error p value false positive? It means null hypothesis, which is written as HO. Null hypothesis is correct but rejected. In my case, when Dr. Siddiqui is coming, he is rejecting my null hypothesis. Actually, I am not pregnant, but Siddiqui is rejecting my not pregnancy thing and saying that I am pregnant. So he is giving false positive report. He is rejecting null hypothesis. This is alpha error p value. जब भी आप चालू बनने की कोशिश करते हो, बेकार की चीज को काम का कहते हो, तो आप अल्फा एरर पी वैल्यू करते हो. जैसे कोई लड़का या लड़की ऐसे बोले कि मैं इतनी सुंदर हूं, मैं क्या करूं, मैं घुसती हूं लाइब्रेरी में, घुसता हूं लाइब्रेरी में, 3-4 लड़कियां गिर जाती हैं, आहें भरने लगती हैं, सबके पानी छूट जाते हैं, ये हो जाता है, बुखार आ जाता है. तो इस तरह का फेंकने वाले लोग अल्फा एरर करते हैं. वो क्या कह रहे हैं? खुद को खुद से ही फॉल्सली पॉजिटिव मान लिया है. नॉन सिग्निफिकेंट होते हुए भी बोलते हैं कि सब मुझे ही देखती हैं. वो है अल्फा एरर पी वैल्यू. And what I was saying in Hindi was, if you think every girl looks at you or you are the most beautiful, you are overestimating yourself. Overestimation is alpha error. And actually, you are just as any other person. if you look at genetic level, you are non-significant, but you consider yourself as significant. This is alpha error, when you overestimate yourself. And beta error is when you underestimate. So example of beta error can be, let's say this time Dr. Deepak went to my batchmate Sarika Pallepu. Sarika Pallepu had done his MBBS from China. He was my batchmate at AIMS New Delhi. We both were doing PG together, and she was more intelligent than me. Actually, she was not more intelligent. I was doing beta error. Beta error means I was underestimating myself. Only thing is, Sarika was interested in study and I was interested in somewhere else. So that's why I was getting less marks. But the main thing is, beta error means if I underestimate myself, if I think no one love me, I am less than Sarika, I am less than other people, I am giving myself negative report wrongly. This is beta error, false negative. So if Deepak went to Sarika and Sarika is pregnant right now, Makasam, nothing to do with me. She is separate, I am separate. She is pregnant right now, suppose. And in a pregnant lady, Dr. Deepak said it is just pseudocyesis. You are feeling like mother, you are not mother. So which type of report he gave? False negative. In case of Dr. Sarika Pallepu, null hypothesis was false. In case of Sarika Pallepu, there was something significant in her abdomen. So in her case, null hypothesis was false. But Dr. Deepak came and he accepted null hypothesis. He said, actually, it is not a pregnancy. You are just feeling like it. So he gave false negative report. This is beta error. And in this case, what is happening? Null hypothesis was accepted. Null hypothesis accepted. But in reality, null hypothesis was false. So it is the same case like Dr. Sarika. Dr. Sarika was pregnant. So in her pregnancy, it is not null. There is something significant. So null hypothesis was wrong. But still Dr. Deepak accepted it and said you are not pregnant. And gave false negative report, underestimated the pregnancy. This is beta error. So beta error means null hypothesis false but accepted. What is happening here? Okay, do remember. If they say null hypothesis false and accepted, beta error. If they say null hypothesis correct but rejected, alpha error, p-value. But many a time they ask question only from false positive, false negative. Remember, alpha error p-value is false positive, beta error is false negative. Okay? Chalo. So in this question, the answer is 2, beta error, type 2 error. Typhoid oral vaccine is given on day 135. 3 days it is given. It is a live vaccine. All oral vaccine are live. Endemic typhus is by rat flea. Rat flea you can remember by thinking that Chota Bheem is sitting over it with a gada. So the mnemonic is BHEM. And in BHEM, B stand for bubonic plague. They have asked in NEET exam already that what is the causative organism of bubonic plague? Causative organism is Yersinia pestis. Then H is for hymenolepsis, which is transmitted by rat flea. E is for endemic typhus. Endemic typhus. And endemic typhus other name is murine typhus. Okay. So rat flea, why I made the mnemonic BHEM? Because to remember the 4 disease name. But one more logic is Chota Bheem is our local hero na. Endemic to India. Endemic typhus. Just like typhoid is endemic in India. That's why endemic typhus is caused by Rickettsia typhi. Rickettsia typhi is the causative organism of endemic typhus because typhoid is endemic, just like Chota Bheem is endemic. And rat is also endemic in India. So endemic typhus by rat flea, do remember, not by louse. Louse transmit 4 disease. Remember by mnemonic PERT. Louse is lice, head lice. PERT stand for pediculosis epidemic typhus, which is by Prowazaki, relapsing fever, trench fever. So why the mnemonic is PERT? Because remember in your childhood day when you used to take out lice and kill it, it used to produce a sound of PERT. So the mnemonic is also PERT. Pediculosis epidemic typhus, relapsing fever, trench fever by louse. Endemic typhus, flea. Minimum number of ANC visit as per Government of India is 4. As per WHO is 8. And if they ask ideal ANC visit, ideal number of ANC visit is 13 to 14. 7 in first 7 month, 1 per month. In the 8th month, they want 2 visit every 14 day. In the 9th month, they want 4 visit, 1 per week. So 7 plus 2, 9 plus 4 is 13. Plus if someone went ahead, it can be 14. So 13 to 14 is ideal visit. 8 is WHO, 4 is Government of India. India belong to which phase? We just discussed it. Late expanding is India. Early expanding birth rate is high. And we are now birth rate start decreasing, death rate also decreases. Late expanding. Then denominator of perinatal mortality is total live birth. What is perinatal mortality? Peri का मतलब होता है चारों ओर, natal का मतलब होता है birth. तो पैदा होने के चारों ओर is perinatal. Peri means around, natal means birth. So around birth is perinatal. And when we write perinatal mortality rate, it includes 2 components. First, all the stillbirth. Second, death in first 7 days. And in India like country, we divide it by total live birth. And we multiply it by 1000. Some small numerical can also come on it. They can give you a numerical like there are total 4050 birth, out of which 50 were stillbirth. So you will subtract stillbirth from 4050. Only then you will get the live birth. And out of this 4050 birth, 50 died. And there were 150 people who died in stillbirth, 50 people who died in first 7 days. So what is the perinatal mortality, they will ask. And you can simply calculate it here, that it is 150 perinatal stillbirth plus 50 neonatal divided by 4000 into 1000. So this 30 will cancel out. 200 by 4, it will come 50. So perinatal will be 50 here. Like the same calculation with same data, I was telling before exam, like this time I am telling you before exam what question will come. I was telling it in one of the class before exam, and exactly same data question came in that exam. And actually student told me a lot of question came from guest paper, because all this guest paper are from those topic which they will definitely ask. So if you are listening my whole session, I can guarantee say you that 80% question in your upcoming MCI exam, minimum 80% will be from the explanation and question which we discussed already in this session. I know this session is taking a lot of time, but I want you to finish it completely, so I am taking it. If I am trying to protect from meningococcus, we can use rifampicin. Out of these 4, rifampicin is better. है ना? चलो. Then disinfection action of chlorination of water is due to which? Mainly hypochlorous kill 80% bacteria. Na? I said hypochlorous, HOCl minus, it kill maximum bacteria. Okay, so do remember hypochlorous is the main one who kill bacteria. Which is not responsible for hardness? Calcium carbonate. You must have seen, if you boil water, white thing deposit around it. That is calcium carbonate. It do not cause hardness. It only deposit after boiling. So calcium carbonate not causing hardness. Then in a cancer treatment, you find survival rate of a new treatment as compared to standard therapy, and you found p-value 0.4. P-value 0.4 means there is 40% false positive, because p-value is telling us false positive. 40% false positive. So it's too much false positive. We cannot trust on this study. There is a lot of false result. So it means newer modality is not significant. It is useless study. Do remember, whenever p-value is less than or equal to 0.05, 0.05 means p-value is less than or equal to 5%. देखो, अगर आप किसी एग्जाम में केवल 5% क्वेश्चन तुक्के से सही मारते हो, तो यानी बाकी तो आपने सही मार दिया ना, यानी आपका रिजल्ट सिग्निफिकेंट आएगा. In any exam, if you tick only 5% question false positive, because p-value is false positive. If you tick only 5% false positive, it means in 95% you were sure na. So that means you can get a significant result. So similarly in study also, if we do very less mistake, less than 5% mistake or equal to 5% mistake, in that case study is called as significant. And if study is significant, we reject null hypothesis. Okay, study significant and reject null hypothesis. Because null hypothesis यही कहता है कि स्टडी नल है, लुल है, बेकार है, और एंड में आ गया कि स्टडी काम की है. तो इसका मतलब शुरू में बनाया हुआ नल हाइपोथेसिस बेकार है और हम उसको रिजेक्ट कर देंगे. Null hypothesis say that new drug is null, lull, useless, not significant. And in the end, we are getting that error is very less, study is significant. So if study is significant, it means initial null hypothesis was wrong and we reject it. Okay. This topic of p-value null hypothesis also I have explained in detail in one of my YouTube video. If you want to listen, you can listen it. It is in Hindi also, full detail. Yeah. But in English also, you can see the videos freely available on my channel. But I hope this is clear here that if the error is too less than 5% error, then study is significant and then we reject null hypothesis. This is most important line to remember. Second important line, p-value is same as alpha error. Both means false positive. Both means overestimation. Okay? Chalo. Next question, in comparative study, non-parametric test. Listen, my dear friend. There are two type of test, parametric, non-parametric, on which question has already came in NEET exam. Parametric we apply when we think that data is normal distributed. So if it is normal distributed, it's parametric. And in parametric, mostly we have tests which are testing quantitative data. And what are the tests which we do on quantitative data? Quantitative data, if it is written pre, post, before, after, we do pair t-test. If it is not written pre, post, paired, after, and there is two group, we apply unpaired t-test. And if it is three or more group, we apply ANOVA. One more name of unpaired t-test is z-test. So only these 3-4 tests are parametric. Rest all tests are non-parametric. And in non-parametric, data is skewed. If data is like this is positive skewed or right hand skewed. And if data is towards this side, lower side, it is negative skewed curve. So non-parametric is when the data is skewed, we use non-parametric. And non-parametric include chi-square, Friedman test, Crucial-Wallis test, Wilcoxon rank sum test, Wilcoxon sign rank test, McNemar test. A lot of tests are there in non-parametric. We need not to go into detail of that. Just remember these 4 are parametric, rest all are non-parametric. So if you remember these 4, you can answer what are non-parametric. And one more thing is that has been asked. If you want to know relationship between height and weight both are quantitative. And if you will want to know the relationship of height and weight, you will use the Pearson correlation coefficient. So this question can also come in which type of test we have Pearson correlation. So P for Pearson, P for parametric. And Pearson will be linear, like we are comparing height with weight. So if height increases, weight increases, this type of association is linear. So whenever you want to know relationship, for relationship, we use correlation. And in P for parametric, which correlation coefficient we use? Parametric, we use Pearson correlation. Non-parametric, we use Spearman correlation. But they mostly ask Pearson parametric. Okay, chalo. So these are advanced topic being asked in NEET, so you should be ready. When we talk about Factory Act, true thing is we do not allow children to work below 14 years. Below 14 is not allowed. 15 to 19 are allowed to work only 5 hours per day, only between 6 a.m. to 7 p.m. in non-dangerous condition after fitness from surgeon. Why surgeon? Because surgeon will check for hernia and these adolescents can be involved in lifting weight. So after checking for hernia, they will be allowed to lift weight. Okay. So next question. Pasteurization of milk, we already have discussed. Folder wet method 63 for 30 minutes. When it is 72, it is not 20 minutes, 20 seconds. That's why this is not correct. Okay. This is kissing bug, Imran Hasmi of insect kingdom. Can you see this thing coming out? Spout. This is the characteristic of it. It is known as redwood bug. or kissing bug, and redwood bug transmit Chagas disease. So in one of the class, students say, sir, it is very easy to remember. Redwood bug Chagas chumma deta hai. Redwood bug give Chagas very good kiss. And why they call it kissing bug? Because it only bite near lip. Very turkey, huh? Imagine if he like to bite near any other hole, what we used to call it. So this is very easy to identify. Redwood bug Chagas disease. Then in a pregnant female who got infected in 22 weeks with rubella, what will you do? Rubella problem is there if it is less than 12 weeks, then she can develop congenital rubella syndrome in which there is sensory neural hearing loss, patent ductus arteriosus, and cataract. This three thing is in less than 12 weeks. If someone is 12 to 16 weeks pregnant and then rubella infection occur, then it will lead to only sensory neural hearing loss. And if after 16 weeks someone is getting infection, then she need not to worry. We just need to give them reassurance. So she is getting rubella infection at 22 weeks. We need not to worry, just reassurance. No need to give anything. Okay. Then there are value of BP 120, 120, 130, 120, 110 and 200. Which data, mean, median, modes, which thing is better to use? So देखो, मीन का मतलब होता है एवरेज, और एवरेज का क्या प्रॉब्लम है कि अगर एक भी नंबर बहुत बड़ा होगा, जैसे यहां पे 200 है, तो एवरेज उसकी ओर खींचा चला जाएगा. इसलिए हम बहुत बड़ा नंबर हो तो वहां पे मीन नहीं यूज करना चाहिए मिडिल नंबर पता लगाने के लिए, वहां पे हमें मीडियन यूज करना चाहिए. What I was saying in Hindi was that mean is average. So if one number is very big, mean get deviated towards it. Mean is mean minded, get deviated towards big number. So in such case, to find the middle number, we should not use mean, we should use median. Median is better than mean in such case. Next question, zero growth rate is seen in which phase? First phase is high stationary, fourth phase is low stationary. Stationary means zero growth rate. So zero growth rate is seen in first phase stage and fourth stage. High stationary and low stationary, zero growth rate. Then in which fertility indicator we don't include women in reproductive age group? So if we talk about general fertility rate, what is general fertility rate? Total birth per 1,000 female. So it includes female. Total fertility rate, total birth per female, it also includes female. Net production rate, total birth of girl child per female considering mortality, it also have female. But when we look at child woman ratio, it is just children as compared to women. It is not talking about women in reproductive age group, because child woman is not talking about demographic indicator, but these three are demographic indicator. So they need fertile women. Child woman ratio do not talk about fertile. It's simply how many children, how many women. So it do not have women in reproductive age group. Then what is buffalo milk? Buffalo milk, remember, no one can beat a bhainsia. No one can beat a buffalo. So buffalo milk has maximum protein, maximum iron and calcium, and maximum amount of fat also. So everything is maximum in buffalo milk except lactose, which is carbohydrate. Then water, then docosahexaenoic acid, taurine and cysteine amino acid. These four things are maximum in mother milk, human milk. But other than this, everything is maximum in buffalo milk. So buffalo milk has more lactose than human milk? No. Human milk has more lactose. Buffalo milk has more vitamin C than human milk? Maybe. I don't know about vitamin. It has less protein than human milk? Never. Buffalo milk is maximum. After buffalo, second number is goat, bakri. Third number is cow. Fourth number is human in terms of protein. This sequence was asked in UPSC, so I am telling it the sequence. So it has less protein than human? No, more protein. It has more calcium than human? Yes, I have written more iron, calcium is in buffalo milk. So it definitely has more calcium. And which vitamin is lacking in human milk? Vitamin K is not there in human milk. Vitamin C is not in egg. Okay. Chalo, what is Nipah virus? All correct. It can cause fatal encephalitis. Yes. Pig act as an amplifying host in Japanese encephalitis. not as Nipah virus. But still, pig is acting as a transmitting agent. So what are the transmitting agent of Nipah virus? Nipah virus is transmitted by date palm sap. ताड़ी से फैलता है. And pig also transmit it. But who is the origin of Nipah virus? This was the image based question in NEET 2024 also. Origin is fruit bat. Fruit bat also give origin to Ebola, Marburg, and Ebola, Marburg are viral hemorrhagic disease. That means due to internal bleeding patient die. So Ebola, Marburg, then Hanta, Nipah of course, and Hanta you will read is transmitted by rat. So Hanta, Nipah, SARS, MERS. SARS is transmitted by severe acute respiratory syndrome. This is transmitted by civet cat. And MERS is transmitted by camel. But all these have origin in fruit bat. So fruit bat transmit all these disease. Origin. NEET question was also there, so do remember. Now, it is transmitted by Aedes mosquito. This is definitely not correct. Nipah has nothing to do with Aedes. Origin is fruit bat, who during reproductive season like to drink date palm sap. After drinking date palm sap, they have good sex, and due to fruit bat drinking date palm, some of the Nipah virus go in the date palm liquid, which then human consume and human can develop it. Pig can act as amplifying host. This is correct for Nipah. But Aedes transmitted is definitely wrong. Incubation period 15 days. This is also correct. And do remember this one more thing. Nipah and Hanta, they belong to category C bioterrorism agent. And if they ask category A bioterrorism agent, in category A, they usually ask what is the bioterrorism agent in category A. So category A bioterrorism agent is very simple to remember and very frequently asked. First is A for anthrax, then B for botulinum. So you can remember A, B together, anthrax, botulinum. Then two diseases which are very old, almost going to extinct, plague and smallpox. Then two diseases which are viral hemorrhagic fever, Ebola and Marburg. कौन बोला? Ebola and Marburg. 6 हो गया. 2 AB, 2 old disease smallpox plague, 2 Ebola Marburg, and last is tularemia. So everyone is in flow, only tularemia is disturbing the flow. यही भड़वा है ना? This is disturbing the flow, tularemia. So this 7 are category A, these 2 Hanta Nipah are category C. Okay, chalo. If what is the government initiative to obtain TB data from private and government both? That is 𝐒𝐄. We already discussed it. No TB, 𝐒𝐄 for obtaining data of TB. Most peripheral unit of TB with microscopy, DMC, designated microscopy center, is most peripheral unit with microscope. We have already done it. Then number of person affected after contact with primary case within incubation period is secondary attack rate. After primary case, if more people are infected, that is secondary attack rate. And for secondary attack rate, a simple formula is in second round, how many infected, that you have to write above, because a small numerical can also come here, divided by total population minus those who are immunized. For example, always remember this thing. If they talk about measles and they talk in the question that there are 2 parent or some guard, adult are immunized. They will not tell you. This is hidden information. Adult are immunized for measles, minus those who are infected in first round. Multiply by 100. This is the formula of secondary attack rate. Very commonly they ask question. And they ask question, people infected in one incubation period. So people infected within one incubation period is not primary attack rate. People infected within one incubation period is secondary attack rate, because first someone already got infected, then he infect other. So this is secondary attack rate. Okay. Chalo. Next question. That in a population of 100 people, screening test to detect diabetes introduced, which detected 90 as positive. When gold standard diagnostic test was implemented, 100 case came out to be positive. What is the sensitivity? We already have seen what is the formula of sensitivity. Sensitivity means true positive by actual disease. So disease is something which we detect by gold standard, and gold standard is saying that 100 people are coming positive. But when we applied the test, then only 90 people came true positive. So 90 are true positive, and gold standard is telling that 100 are having disease. So what is the sensitivity? 90 by 100. That is the sensitivity, 90 by 100. Simple. Okay. So don't be scared by this type of question. This can be very simple sometime. Unit of study in ecological study, we already discussed. Ecological is the other name of correlational. And in ecological or correlational study, what we do? We simply take population data and correlate it with hospital data. Like if I am saying breast cancer is more in USA due to more fatty diet. So fatty diet is population data, breast cancer is hospital data. This is an example of ecological study. More breast cancer in USA with more fatty diet. Simple ecological study done on whole population of America. Okay. And Mission Indradhanush we already discussed. Initially it has which 7 disease? Measles, DPT, then OPV, Hep B, BCG. So it do not have meningococcus thing in it. And it has the DPT, so tetanus is there. It has BCG, it has measles, but not meningococcus. If 2 live vaccine are given, minimum gap should be 3 to 4 weeks. If one option they ask out of 3, 4, minimum is 3, but usually we take gap of 4 weeks. Index of, we already discussed, operational efficiency is by annual blood examination rate. Operational efficiency means people are making slide or not. This is by annual blood examination rate. And what is annual blood examination rate? How many slide you made from fever case. Slide made from fever case by total population multiplied not by 1000 but by 100. So this tell whether people are working or not. ABER. Acha, what spin rate tell? Spin rate tell about endemicity of malaria. Like in any village population, if you found that more than 10% children have enlarged spleen, it means they might be repeatedly getting attacked by malaria pathogen which cause rupture of RBC, and those RBC deposit in spleen, so spleen enlargement occur. So in endemicity, whether malaria is constantly present or not, that is by spleen rate. What does infant parasite rate tell? It tell recent transmission of malaria. This has been asked already in MCI exam. Recent transmission by infant parasite. And API, impact of malaria control program. Okay. False about transmission of rubella. Rubella in early pregnancy cause more serious problem, not mild problem. So this is false. In early it is more serious, not mild. Then amplifier of Japanese encephalitis is pig. In JEE, they can ask who is the reservoir or who is the maintenance host. Reservoir or maintenance host means that animal which keep the JEE virus in non-rainy season. बिना बारिश में वो किसके अंदर छुपा रहता है JEE का वायरस. So in non-rainy season, it is ardid bird, bagula, heroine. This ardid bird store JEE virus as a reservoir. Then story enter a new nuisance mosquito 𝐒𝐿𝐹. और 𝐒𝐿𝐹 में इतना दम है कि उड़ती चिड़ैया के बम में काट लेता है. So 𝐒𝐿𝐹 bite ardid bird, and then 𝐒𝐿𝐹 bite in bum of Suarva pig. Then from the pig, it bite human, and human are dead end host. Dead end host means if a 𝐒𝐿𝐹 mosquito bite me, I can develop JEE. But then after biting me, if he bite my wife also, then infection will not go from me to my wife. One person to another person, infection of JEE do not go through mosquito. It need a fresh mosquito of 𝐒𝐿𝐹 to bite my wife, only then she will develop JEE. That's why I am dead end host. And I used to think that pig must be singing this song for JEE virus. कि मैं तेरा amplifier है ना, पिग के लिए से ना गाना गाता होगा ये जेई के लिए कि आई एम योर एम्पलीफायर. पिग इज द एम्पलीफायर who multiply the virus, of course. And when QLEX transmit it, it transmit it by trans ovarian cycle. So it goes through the genital organs of QLEX and then it goes to pig. Okay, so it is trans ovarian cycle. Now I have discussed it. If they are talking about BP we can measure. So whatever we can measure is quantitative, and they have used the word before after. If you found the word before after and data is quantitative, don't doubt, answer is undoubtedly pair t-test. Before after pre post match word, pair t-test. Next type of question they can give, they can ask which of the following is positive causative factor. Do remember, whenever odds ratio or relative risk is more than 1 means positive or causative factor. And if relative risk or odds ratio is less than 1, like suppose it is 0.85, less than 1 means protective factor or negative factor. Protective or negative association, less than 1. This question has already been asked in NEET exam, that green tea drinking cause less heart attack. So if it is less heart attack, relative risk will be 0.85 because green tea is protecting from heart attack. Then if the relative risk is equal to 1, just 1 means no association. For example, smoking and accident, no association, like that. So how many are positive? Positive means how many are more than 1? More than 1, you can say first is more than 1, second is more than 1, third is more than 1, fourth is less than 1, then fifth is more than 1, then last sixth is more than 1. So how many are more than 1? 1, 2, 3, 4, 5. So you just have to count based on this odds ratio. Rest data is useless. Just follow here and you can find the answer. So similarly, they can ask how many are protective association. Protective is 0.97, 0.53, 0.56. 3 study protective or negative association. So here answer is definitely 5. 5 are positive association. Bilateral pitting edema we already discussed. This is adulterated mustard oil. What is the poison? Sanguarine. What is the best, most sensitive test? Paper chromatography test. One thing which I wanted to discuss is vaccine which we store at PHC. We store it in ice-lined refrigerator. But in the ice-lined refrigerator, there is a special type of thermometer which is dial thermometer. The topic which I want to discuss is, in a ice-lined refrigerator, which is like the same thing under which in many ration shop they keep ice cream, they will ask which is at the base, which is at the top. So base of ice-lined refrigerator is much cold, is much stable. If light goes out in PHC, temperature fluctuate. Base vaccine, their temperature will remain constant. So in the base we have to give live vaccine, because live vaccine need more stable temperature. And in the upper part we can keep other vaccine who are not live vaccine. So upper part are those which are not live vaccine, lower part are live vaccine. And you have to remember the live vaccine because live vaccine are contraindicated in immunocompromised condition and in pregnancy, except one vaccine, that is yellow fever vaccine, which can be given in pregnancy. Rest all live vaccine are not given in pregnancy. So sometimes they create a clinical question that there is a nephrotic syndrome child on a steroid, which vaccine we don't give. So we don't give any live vaccine because he is immunocompromised. So what are the live vaccine? Very simple to remember. 5 you can remember by CP-PE-IJO. Come to CP. What is that CP-PE-IJO? C is for cholera, P is for plague, cholera, plague, polio, I for influenza, J for JE. Why I keep them together? Because these 5, they are live also, killed also. So if you remember it together, CP-PE-IJO, cholera, plague, polio, influenza, JE, you can remember both live and killed easily. After this, the 6 vaccine which are live is very simple. All oral vaccine are live. So rotavirus is live, and rotavirus, do remember the side effect is it cause intersusception. Intersusception means telescoping of intestine. One part of intestine goes in other. That is the problem with rotavirus, and rotavirus is something which we don't give after 6 months. not after 6 months. If a child do not get it till 6 months, we don't give it. So rota is the second live vaccine. Then oral vaccine which is given is typho oral. So typho oral is also live. Then we already know BCG and MR is live vaccine. We just read yellow fever is live vaccine, which can be given in pregnancy. And last is varicella, which has 𝐒𝐿 strain. And you also must have seen that performance. Savila vila, savila vila. It's time to Africa, waka waka, ayo, and waka waka. Which type of performance was it by Shakira? Live, na? So varicella, 𝐒𝐿 strain is also live vaccine. So these are the 6 you have to focus. Very simple. Oral, rota, typhoral. Then BCG, MR. Then yellow and varicella. Rest 5 are CPP, IJO. So these are kept in the base. So in recent NEET exam 2024, they asked which is kept at base. So one of the option was BCG, you can keep it at base. Polio live vaccine, you can keep at base. So these are the kept at base. And in the upper part, which one you put? You can put hepatitis B. In hepatitis B, they ask which component is there. HBsAg is there. As surface component will be there. And then with HBs DNA is there. That's why hepatitis B is a recombinant vaccine. Other than that, we can put pentavalent above, we can put DPT above, like that all the killed vaccines or all the protein vaccines we can keep above. But if you want to remember the name of all the 7 killed vaccine, it's very easy. You just have to remember 2 vaccine name under killed vaccine. One is hepatitis A, other is rabies. Remaining 5 are CPP, IJO, cholera, plague, polio, influenza, J. So you can remember all killed here. Recombinant is hepatitis B. Protein vaccine is pertussis. So very simple to remember. P for protein, P for pertussis. And we all know toxoid is diphtheria and tetanus. So by this way, we almost remember all the vaccine. Only last thing is cell wall polysaccharide vaccine, which is meningococcal, pneumococcal, and VI polysaccharide of typhoid. These 3 are cell wall vaccine. So this is vaccine classification also, which we revived. If I am talking about PSC in hilly area, can you give the answer? I am waiting for your answer. PSC in hilly area, do reply. If I say PSC in urban area, PSC is at 50,000. In hilly area, can you tell me what is the PSC? It is 20,000 in hilly area, 30,000 in plain. Many people, they think they remember, but they still do mistake here. So don't do mistake. Do remember, hilly 20, plain 30. Then Sakir tape is an example of appropriate technology. ORS is also example of appropriate technology because rural people can easily use this. And do remember these 4 pillars which they keep asking. Also remember in community participation, who give idea? Community give idea. And who monitor the implementation of idea? Monitoring is also done by community. So you will say कि what doctor will do? मैं क्या करूँ? नाचूं? नहीं, doctor role is to bring the community together. But idea and implementation both are by community. Okay. Chalo, most common influenza virus we already discussed is type A. That's why it lead to SIFT, major pandemic. So type A is most common. Every 10 years this pandemic occurs. So it is a cyclic trend example also. A study that gives prevalence of depression, we have discussed prevalence is by cross-sectional study. That's why snapshot study. A spread of TVS, this is the part which I have already given. It is written here, which do not have live birth, child death rate. So it means we have finished all the questions which was from this section. Thank you so much for this session. If you have any doubt, any question, don't hesitate. Message me on my WhatsApp number. I will definitely try to help you. In the PW Meded Telegram Sankalp group also, you can post your doubt and we will definitely more than happy to help you. Thank you so much. Hasta la vista. Das vidania. If you have any problem, any complaint, anything you want to ask, any topic which is difficult, not clear to you, you can always tell me and I will be more than happy to tell you about that. Okay. So thank you so much for this session. I hope this session is useful to you. Hasta la vista. Das vidania. Bye bye. Thank you so much. Nikhil. 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 Nikhil is not here. Bye bye. Thank you so much. I will. भाई इसका पहले दे दे, कोई डाउट होगा बच्चों का तो देख लूं. इसका डाउट दे दे भाई. So thank you so much. I really like the way you were coordinating, replying. Do one thing for sure. Please, now in the remaining 5 days, try to do 300 questions per day. Because if you will do 300 questions at your home, you will easily do it in the exam. And try to do it in 150 setup in the same time when you give real exam. And in this 300 question, try to do PYQ. And if you have not done NEET 5 year till now, please do PYQ of NEET year wise for sure. Because MCI exam, they take many questions from NEET word to word. NEET have good recall because it is only in one session, and teacher like me also sometimes give it to give you better recall. But FMG can never have good recall. So if you want to know the real question, real language, how the exam question come, practice NEET. If you want to have no anxiety, no fear in the exam, do 300 question at the same time when exam is there, and you will definitely rock with more than 180 marks. This 5 day is good enough time to improve your score by 30 number. Just do these two things. Do PYQ NEET year wise and do 300 question in the same time when exam is there, and you will get more than 180 marks. Okay. So thank you so much. You enjoy the class. You are with me for this long 4 hour. Thank you so much. And this session is really hopeful. This session is really going to be useful. Trust me, 80% of your MCI exam question will be from the discussion which we did in this session. Okay. Thank you so much. Love you all. Bye bye. Dasvidanya. Thank you. Thank you.